had to call you to tell you that the food that you brought to the party last night was wonderful. It made me think about my grandmother's cooking. Where did you get that food, brother?
I went down to Thomas Rib Shack to pick up the ribs, but when I got there, I seen that they had more than just ribs. I seen baked chicken, fried chicken, corn muffins, vegetables, apple pie, peach pie, and I looked around and I seen a sign that told me that they got chitlins and oxtails on Sunday. Oh, all I can tell you, go down to 2931 15th Street or just give them a call like I did at area code 205-759-5010. Thomas Rib Shack, Tuscaloosa, Alabama.
Head on down to Archibald and Woodrow, some of the best barbecue in Tuscaloosa, Alabama, y'all. Right off of 4125 Greensboro Avenue, Tuscaloosa, Alabama 35405. You can hit them up at 205-331-4858. Also, you can find them at their other location, 1211 Martin Luther King Boulevard, Northport, Alabama 35476, 205-345-6861.
Tastes so good, make you want to slap your mama.
Tuscaloosa, get ready for the T-Town Labor Day Blues and Groove Festival. Saturday, September 4th at SoCo Park, featuring TK Soul, Abel Hollywood,
Is you 25 and
Magic One, Jay Hammer, Miss Jody, Donnie Ray, and the Jay Morris Group. Gates open at noon. Showtime 2 p.m. It's all hosted by MC Sir Anthony. Bring your tents, coolers, lawn chairs, and RVs. Vendors are welcome. Kick off your Labor Day weekend at the Blues and Groove Festival, starring TK Soul, Abel Hollywood, Magic One, Jay Hammer, Miss Jody, Donnie Ray, and the Jay Morris Group. Saturday, September 4th at SoCo Park in Tuscaloosa, Alabama. For tickets and vendor info, call 205-872-2113.
Hey. Welcome to another episode of the all-new T-Town 411 Report. I'm your host, Darren McKinstry, along with my good friend, Big Mike. We're here on this Tuesday afternoon. Mike, I'm telling you now in advance, I'm still a little stuffed up, but hey, we're going to go on with the show tonight. Go ahead and tell them how they can chime in on Sound Booth Radio 106.1 and Sound Booth TV, Mike.
Sure thing, Daryl. I'm glad that you're feeling better. To tune in with us on Sound Booth Radio, just go to your iOS or your Google Play Store, download the Live 365 app, and once you download that free app, then you type in the search bar Sound Booth Radio 106.1. That'll get you on with the radio side of Sound Booth Radio. And to get on with us in Sound Booth TV, just go to YouTube and type in Sound Booth Radio, and that'll have you on with us on Sound Booth TV. Of course, you can also check us out on Facebook Live under the same name, Sound Booth TV.
Okay. Well, Mike, like I said, once again, glad to be back, man. I tell you, I don't know if you paid any attention last week on last Tuesday. I had a little stuffy nose, I just thought it was just a little sinus or whatever just came up on me. And man, I tell you, the next day it hit me like, I guess we forgot that the flu or summer cold still exists,
Yep.
And
I think that's the case.
And that's what it was. I had a severe case of sinus infection, and I still kind of got a little bit, got a cough, small cough. And, the first thing, of course, we thought we had, man, the way I was feeling, I said, man, I ain't contacted this COVID. And, went on. It took me a minute to get up because I had to kind of get my strength back because the way it hit me. And I finally went up to the doctor up there at Crimson Care, and they took care of me up there. Dr. Parmasetta and his bunch, all the nurses and staff up there, man. I tell you, uh, when I say we're gonna probably burn out our essential workers across the board. I mean, doctors, nurses, staff, medical assistants, nurses, RNs, LPNs, medical records, whatever. We're going to burn them out because people are tired of working. One girl told me she was working consistently. She had worked like 3 consistent 16-hour shifts due to lack of staff.
Yes.
And
that's the one thing that they're concerned about. First thing they were concerned about was the hospital bed, but then they say even if they were to get more room, they don't have people to work the staff or do the staffing for those rooms that they starting to get. And here in Alabama, well, I know in Tuscaloosa they had started phasing. There are a lot of LPNs. I don't know if there is a resurgence of those LPN positions coming back or not at this particular moment in time. But I know at one time they was phasing all of them out. So I'm pretty sure that they take anybody who's did anything in the medical field right now. Anybody.
Okay, want to say hello to our good friend Veronica Taylor, who's providing us with the COVID update from DCH Health Systems. And as of 2:37 today, 146 inpatients within the DCH systems are positive for COVID-19. 31 inpatients positive for COVID-19 being treated in ICU. 20 inpatients positive for COVID-19 on ventilators, and 23 inpatients positive for COVID-19 on BiPAP. 18 are fully vaccinated. That's 12.3%. 128 are unvaccinated or not fully vaccinated, which comes to 87.7. So out of the 146 inpatients, 128 of them that's in the hospital are unvaccinated individuals.
Yep.
That's scary, Mike. That's scary.
And I'm interested in knowing if that 12% of people that are vaccinated, are they high risk people?
And one other thing, I like to know which shot did they take, the Johnson or the Pfizer or the Moderna? That'd be interesting to know too.
Yeah, it would be. It would be. Because they talk about the third shot now for people who 8 to 9 months after the second shot.
They did what after the second shot?
Third shot. They're talking about a booster shot.
Oh yeah, the booster
that might be needed. I'm sorry, Darren. What did you say?
She said we're still gathering up together. That was Veronica. Let me just say a quick prayer. Heavenly Father, thank you for this day. Thank you for the opportunity to come before the people and share information. Thank you for all our doctors, our nurses, essential workers in the restaurant field, in the hospital field, medical field, our military, and our law enforcement. All our government agencies, everyone, Heavenly Father, thank you for them. We ask that you go out and heal the ones right now. I want to also say a special prayer for the bereavement families right now. We know what they're going through. Stand by them, let them know. Look to the hills which their help come. In your Son, Jesus Christ's name, we pray, amen.
Amen.
Amen, Mike. I'm not sure if you're familiar with Mr. Eric, teacher used to teach at Central. His son passed away on either Sunday or Saturday, one of them. And we want to say a special prayer for his family. It's like I don't know if it's just because we are paying more attention to the obituary sections, or Facebook is now relating more information to the fact that more people are dying than normal or than we are used to broadcasting or talking about. We want to send to the young family of the young man that got killed over the weekend, to the victim and to the victim suspect family, because it's not. I've came to the point of saying, yeah, there's one person that is dead and gone. That's a victim, but there's also a family that's a victim of the circumstances also. So I try to pray for both sides. I mean, regardless of why, because no one really knows a lot of times. I think we just got to get in the mindset of, hey, try to uplift both sides of the family. And in that way, hopefully that'll prevent from more things happening. I want to say hello to Tammy DeGraffrey. Thank you for joining in. And Mike is getting to the point now where I think more people are saying they're seeing more people living with the COVID that might be, catch the COVID and 2 weeks later they're okay, compared to the first last year when it was attacking our elderly. Mm-hmm. And I still say there's a possibility, but I'm so glad to see that the elderly taking the shot. But there are so many of and don't get me wrong, I'm young. I mean, I consider myself young but wise. I'm in my 50s, but there's people in my family and friends that are in their 50s saying they're not gonna take the shot, and I'm saying you're not considered 62 elderly. You know what I'm saying? I mean, elderly before your Social Security, but you still up there in age, and unless you just don't know, you can be attacked. Your heart can be attacked. Matter of fact, one of my classmates passed away, and bless her family and condolences to them. And I'm not sure exactly what was the cause, but she was in the hospital. So, man, you just don't know. You just don't know.
Well, we're dealing with these other variants that's going on right now, Daryl, and those people who are on the fence or who are not are going to take the vaccine is going to say, well, you see, 12% of the people are in the hospital, so it don't make no sense to get the vaccine if you're going to be in the hospital anyway. They're not hearing that other 80 some odd percent that's in the hospital outside of that 12% of those people. And no matter how many times you try to tell them, hey, it's not to keep you from getting the virus, it's trying to keep you from dying from the virus. Most of the people who have contracted it, and if they have had the vaccination, they're not having symptoms.
Let me see, can I define it a little bit better for some people? And I want to say hello, Kowalski Phillips. How you doing, Kowalski?
KP, what's going on?
Okay, let's say you're outside in the woods, and you got a bottle of off spray. You put that spray on to prevent mosquitoes from biting you. Is that correct?
That is correct.
But it ain't guaranteeing you that you won't get bitten by a mosquito. Do that make sense?
Yes, absolutely.
That's exactly what this virus is. I mean, this vaccination is a short and simple way of looking at it. We're giving you this vaccination for preventive measures of not detecting the virus or catching COVID. But we're not guaranteeing you're not going to catch COVID, but you will be able to at least fight against it if you got the vaccination. And what about number 45 came to Coleman, Alabama, and
wow.
he finally made sense and stated take the vaccination. I took it. He finally said it, man.
But Daryl, didn't he? It sounded like he was sarcastic when he said it, though.
But that's 45.
Yeah,
that's 45 to me. I mean, he.
I can say this, Daryl, and by the way, we got KP on the line with us.
Okay, great.
I would like to say that really and truly, once I start saying about getting a political thing now, most of the Republicans are not taking their vaccination, and it's going to start hurting their numbers to come down to polling time. They starting to realize this now, and that's why you get more Republicans that are saying you should go ahead and take this vaccination now. But you still have other Republicans that are not.
Well,
it's like the Santos and the governor over in Texas.
Mike, I believe them jokers and took that thing. They just telling them folks, man. They just telling them, you know, hey, right now you can go to CVS and get a shot, and I don't guess you have to even tell them who you is sometimes. These jokers taking it. Those political leaders, Republican political leaders, are taking those shots.
And you best know that they are.
Now the rest of the people.
I think that every last person that in the Capitol building, every last person in the White House, I think everybody who has had the opportunity to take that shot has taken.
Yes, sir.
Both of them.
Yes, sir. I agree with you. Cold-hearted, I agree with you. And I think was it the Texas or one of the governors? I think the headline read, "Governor such and such tested positive for COVID after being vaccinated, has been vaccinated," or something like that. Well, once again, you ain't guaranteed you're not gonna catch it.
Well, no, I think what you're talking about it was one of them governors that said that he is going to take the vaccine now that he has contracted COVID. Okay. But he was not vaccinated at first. Okay. What took me out was football season coming up, and Auburn's head coach has contracted it.
Yes, sir.
First year head coach, and of course when they asked him about how he was going to handle vaccinations for his team, he it's a personal decision. Complete contrast to Nick Saban, who said 99% of the Alabama Crimson Tide has been vaccinated. And whoever that one person that's holding out is, I believe he's feeling the pressure now.
Oh, he will. He will. I mean, it make to us it make perfect good sense. Hold on, let me add Veronica Woods.
Well, I mean, I'm liking this conversation because I tell you, it's like it's getting closer to home. Had a few contractors come talking about how their co-workers weren't vaccinated, and now they're fighting for their lives. So I mean,
I think that's what it normally happens. People get to the point where they when they start hitting close to home, they lose somebody or somebody almost die. Then the realization pop in their head. Well, you know what? Maybe I need to go ahead and get this vaccination. And unfortunately, some people wait until it's too late. I heard of a story of someone, and I'm not sure how true it is, but the guy contracted COVID, didn't tell anybody, and went and tried to get the vaccination after he contracted COVID, and he wound up dying after he took the vaccination. So I wonder how many people actually going up in there after they have had been diagnosed with COVID.
We got Veronica on the phone with us. Veronica, what you say about that? Veronica.
Hey. Hey,
Hey, Veronica.
hey, how y'all doing?
Good.
Hey,
You good?
Darryl, you're right. It's Texas Governor Greg Abbott.
Okay.
He stated that he's had the vaccination 3 times. He stated that he's fully was vaccinated and that he received the booster. But no one would know that the way he's been fighting against the mask mandates. People may look at that as masks and vaccines being totally different things, but if you're around here, you don't want to take the vaccine, why would you allow schools and everything to open without promoting mask wearing? So yes, it's Texas Governor Greg Abbott. He tested positive. He took both doses, and he stated himself. Nobody verified or saw or said that there was a record of it, but he stated that he had his booster vaccination as well.
Okay. I thought I read something relating to Texas governor. Ron, what
I hate to
about?
say I don't believe that, man, but most of the time, if they out there yelling they had something, they would have showed that vaccination card.
That's another problem that we're about to begin to run into.
A politician, or you would have let folks see you get the shot in your arm.
Mike, that's another problem we're about to run into.
Yeah, those people that are against anti-everything, they're not going to show anybody anything.
That's right.
That's just like a lot of the politicians that y'all were speaking about earlier. They ran and jumped in front of the line before healthcare workers when that vaccine became available. Nobody knew it. Biden, Kamala Harris, and other people like that took that vaccination so that we could see. Mm-hmm. But after Trump had done what he done, yes, they're saying it now, but what did he do at the beginning of the pandemic? What can he do to help reverse what he did at this point? You have people who are unvaccinated who are saying, when they ask them, well, Trump has now taken the vaccine and you're a Trump supporter, how do you feel? First thing they say, well, that's his choice. So they're not even listening to him as it relates to that, because he took it, and it was weeks before we knew that he took it. So these conservative or Republican governors are not running to jump to be seen that they had taken they've taken the vaccine. No. Because they're too stubborn. It makes it look like a walkback on the way they're behaving.
They'll rather look stupid. They'll rather look like that than they look like they walk back on their word.
Exactly. Mm-hmm. I don't know not saying that there's not one or a few, but I don't know anybody who's taken it on camera that's a conservative or a Republican. There may be, but the starch hardcore ones who are against or anti this and anti that, they took it. They ran to the front of the line and took it. Way back when it became available. And many of them we don't know until now. I agree with you on that one,
Veronica. I think that they have taken it. And the thing that scares me the most is, as of last week, we started having a bunch of what you call mini spreaders, mini super spreaders in football games, high school football games. Well, we are exactly 10 days away from Alabama playing that first game, and you think that it's not going to be packed up there at Mercedes-Benz Stadium?
Oh yes, it's going to be packed. Most people I've seen when I went to Georgia, very few of them wore masks. They wore them where they were mandated, but very few of them did. And I see so many people, again, the Delta variant is the most contagious thus far, but there's another one that's even stronger. That one, and a lot of people are starting to think, well, hey, wait a minute, how are they knowing that these things are coming? So a lot of people are beginning to question the government and to question how are they just coming? Yes. But what it is that COVID-19 was off the chain, the initial one. It was something we had never seen. Remember, it created the pandemic. And as with all other viruses, it began to mutate. You had people that approached it the wrong way, that approached the pandemic the wrong way. And as we saw earlier this year, when you had the mandates and things like that, and the things closing early, only a certain amount of people being able to gather, promoting most gatherings outside, which that's not this great thing. See, some of the things that we promoted earlier, people have that set in their mind and they're not willing to change. This promoting these gatherings outside, I'm not for that. They had that thing up there in Coleman, and Coleman was full. Their hospital system is full. But yet and still, they had that thing out there, and you can count the ones that had on masks. But he's standing up there saying, take the vaccine. He did. But no one knew it until well after the fact. So now people are set in their ways. People go with what they want to hear. If you've been locked down for almost over a year, and things have still not even staying open all night like they were, like Walmart, some places not staying open until like the mall still closing at 7. So these people have gotten tired of being in the house, but they won't sit back and just think about it. When the numbers went down was when we had the curfew. When the numbers went down was when people started to get vaccinated. Then the CDC and other people, still not knowing this virus, messed up and said that if you're fully vaccinated after your 2 weeks of your second dose, you can go without a mask. We still didn't know enough for them to say that. But that's all these people wanted to hear. So now it's hard as I don't know what to stop them from gathering. And my thing is, okay, gather, but why are you guys taking snapshots, taking pictures with people that don't live in your home, that you barely know, even family gatherings? I don't go to these big family gatherings. You guys don't, this is not your nuclear family. You don't live in the home with them. You're taking snapshots, you're taking pictures. And if they said don't stay in a room more than 15 minutes, that was one of the things that they did and suggested to help them when it first started. So why are you in these rooms and these parties 30 minutes to 2 hours taking snapshots with every Tom, Dick, and Harry in town? And then these numbers and the healthcare workers are overwhelmed.
You know, and the one other thing that I'm so interested. Well, I'm not interested. It kind of upsets me to hear when I hear people say that they haven't taken the vaccination yet because they haven't had time.
And then some of those are the main ones not wearing masks.
I saw an episode tonight on the news where a young lady, she in her 30s, her husband has yet to wake up because he contracted the coronavirus, but she stated she scheduled an appointment for the shot and canceled it 3 times.
Saw that.
And so that right there tells you the mindset. You want to get it, but then you're scared, so you cancel. And then now you're in this critical crisis where you don't know if your spouse is going to make it.
That's to me, that's one of the.
I think I saw that story
that I've heard for people not taking the vaccination. I haven't found one good one yet, other than, and I really haven't found one good one yet. But that one,
many were saying that they were waiting for the FDA to approve. And I just sit there and I look, and I'm like, how many of y'all really even truly know about the FDA? You know, some of y'all are waiting on the CDC, and the CDC hasn't quite gotten it right. So what makes you so inclined to take it because the FDA approves it? You take vitamins, herbs, and minerals all day long out of these stores that the FDA hadn't approved.
All day.
Yes. Be the first one in line.
So now you're waiting on the FDA approval.
Yeah. But that's to me is another excuse because they heard that, well, it hasn't had the final approval yet, but I ain't taking it to the FDA. You know what I'm saying? That's just another excuse that you can pull out of the bag. So that you, because they were talking about they was going to approve Pfizer as early as today.
And they did. So now so for those people saying that, what is the reason now that you're not taking it?
Absolutely.
I really, if I can say, I really appreciate the numbers that I saw Veronica post, and it's astonishing to see the number of people who are in the hospitals and how many are unvaccinated. 82%. That's a lot.
87.
87. I'm sorry. Excuse me.
87.
Thank you, sir.
Hey.
But still, that's a lot.
Yes.
And nobody wants to.
Y'all, some people don't even want to talk about it because it'll impact their get-togethers. It'll impact their partying. It'll impact. Well, if they don't get it, you're gonna get it. You know, this is not the normal. There's been no pandemic like this. The flu this is not like the flu. Yes, the flu has done great harm to people, but when have they ever reported hospital beds being this full behind the flu?
Yeah.
And Dr. Fauci stated today that if you're looking for this to end in a month or two, you're gonna be sadly mistaken.
That's why I don't understand the mask mandates for the school only last until September the 10th or something like that.
Right.
Well, most of the schools have said that is they're going to be flexible with that as far as if it requires longer time, then they'll give longer times. But
I mean, with the city schools, they're going to revisit it. They've already given the date, but they're going to revisit it. So what are they expecting to happen when just a couple of weeks ago, we were astonished that the numbers were up to 115, 125, 126, 136, and they're still up today.
Yeah, and more of those people are young people. We talking about teenagers and younger that are actually in hospitals. They're saying that they need more help in pediatrics now because they weren't expecting so many young people to come in the hospital because during the first wave, young people weren't the one that were getting sick.
Well, let me ask you this. Let me ask something right quick that y'all brought up about city schools. If it's mandated that you wear it during school, why is it not mandated during after school activities?
Wow. Can I go and tell you, Daryl? I have heard from a couple. I work with a lot of teenagers, and I've heard from a few of them that actually say that they're not enforcing the mandate in the city schools. Like they have teachers that are walking around without masks on, and we talking about include the people that's house visit the principal even that has been walking around without masks on. So if you can't get the adults to do it, do you honestly think that you're gonna get them teenagers to follow suit?
No, I know that was just a little teaser, but it ain't gonna happen. It's unforceable and probably won't be enforced. But I think it take us to the level of saying, and I told Sonya this just the other day. In other words, what has came to truth is take it or die with it.
Right.
It's to the point where the government is saying either you're gonna take the shot or you're gonna take a chance and die with it. Because they're not doing anything to say
or how you gonna take care of your family. United Airlines.
Right.
The military.
Right.
Veterans administrations.
Right.
They're mandating these things. And it's not just the federal jobs. Many of the other jobs are mandating these things. And they're saying that even because there are some healthcare workers still not willing to take it. And some are protesting in New York. So those people have said that we are prepared to let them go.
And they
so some are going to change their minds when you a nurse, you a doctor, you making 45 upwards an hour, and they say, well, you don't want to be. Some may allow you to be tested every day or every other day, but for those that don't, and they mandate that you take the vaccine, how are you going to take care of your family if you refuse?
Good question.
That's going to make some people rethink it.
LaShonda Harper said the requirement for masks should be mandated for everyone, especially in the schools. What kind of influence are you as a teacher for these children? Stavetta say you can die with the shot. That is happening now.
There's a young man that has asthma that was fully vaccinated that passed away. But look at the numbers that we gave today.
Right.
At DCH.
In the example,
imagine that asthma is a very, very high risk. He was one of them.
Right, and he was vaccinated. So a lot of these people stop trying to be doctors and have all this medical knowledge they did not have. People with the medical knowledge, we're still learning. And it's sad to say, a lot of people would say, well, they don't know everything. No, they don't. But they do know more than the average Joe. That's just like a plumber. My brother may come over here and patch up the under part of my sink. But if I keep getting a backup and a backup, then I'm going to have to get a professional. And that professional may patch it 1 or 2 times. And he may say, well, it's coming from your house to your yard. Well, he may not be that experienced. He's a new plumber. Another plumber may have to come in and say, okay, we got to look at this thing this way, look at this thing that way. We got 2 professionals out there trying to figure out what to do with something that they're professionals they're dealing with. Same thing in medicine. You have professionals trying to figure out what to do with this new thing that hit. There's still remnants of the Spanish flu from 1918. If you isolate DNA, there's still bits of that flu still out here. But the herd immunity and the things that they did then without the technology that we have today and the common sense that people use got it to the point where it was almost gone. Like I said, you can isolate it today. So there are some things that are just going to be there and they're just going to mutate. What people do not understand is they keep saying you can do this and you can do that. The virus is mutating. So your fears are valid, but your fears at some point don't continue to spread misinformation. If you say someone has taken it and has gotten whatever, okay, that is the point. No vaccine is designed to kill or stop a person from getting something. There will be breakthrough cases. There will be cases that are really, really serious and doing the opposite of what you wanted to do. But you have to look at the overall numbers. And you can't be talking about people that come from the hospital that whisper something in your ear or tell you something on the side. If they're willing to whisper that in your ear and tell you something on the side about a pandemic, then they need to be willing to get on Front Street and stop spreading misinformation, or be willing to put the information out there that yes, somebody came that was vaccinated and this and that happened, but also look at the numbers of the unvaccinated and what's happening.
That outweighs it's like if you got a scale around it, 87% unvaccinated is in the hospital, and 12% on the other side of the scale that's vaccinated. No one is saying 1 out of the 12 or 2 out of the 12% possibly won't die. No one is saying that, but they're showing. Right. But there's definitely a 1 in 10 chance of 87% dying compared to the 12%. I mean, let's weigh this, y'all. I mean,
it's just like we talked y'all last week when the chickenpox vaccine came, the hepatitis B vaccine came. Did we ask those people? Now, let's say it was somebody who was for religious reasons did not take vaccines. Did we ask those people what's the ingredients in it? How long have you studied this? What was the ratio of people and the race of people that this happened to? Did these many people actually still get chickenpox? Because with the chickenpox vaccine, I didn't even ask, but I was a young nurse. So I wondered about it, like, when did y'all start this? Because my other daughter didn't get it. But I, as a nurse, didn't ask because I was a young nurse then. But what they did explain to me is that if your child gets the chickenpox, the idea, the premise, the hope behind the vaccine is that it will be mild. Same premise with C-19.
I would ask folks, how many of y'all know the actual ingredients in Tylenol and Advil and Aleve?
Or like we say, those other herbs and vitamins that they go down here and take from Nature Brand and Spring Valley and all these other people, not even at Manor. They don't even go to the herbal store or the healthier stores like Manor. They run in Walmart because somebody told them this or do that. Y'all, some people will go for their high blood pressure. Our race of people is the race that refuses to understand that high blood pressure runs prevalent in our community. Oh, I was scared. That's why my blood pressure, every time I get scared, my blood pressure be up. Well, baby, if your blood pressure be up every time you get scared, that's a hint to take it once a week when you ain't scared and see what it's doing. It may not be 200 over 180, but it may be 160 over 90, and it's still too high. But every time you tell them something, they have an excuse for something.
Apple cider vinegar all day.
Yeah, I'll take apple cider vinegar all day for ailments, and those things help. Those little things, they do help. And if it's probably you initially starting having this problem, it may help you. That and prayer may help you. Nobody's knocking that. But when you consistently or 2 or 3 times you get a blood pressure reading that's so-and-so or so-and-so, you may need to look in, and you know you're not going to exercise. The first time, I'm going to start walking. I'm going to start walking because they're trying to prevent from taking that medicine. But if somebody tells them an herb or some other kind of thing that a doctor don't prescribe and you can go buy it off the counter, they'll go do that and try that all day long, forever and a day, because then they can say they're not taking no medicine. Then once it used to be so funny when my great-grandparents would take medicine, and I used to say, dang, that's a lot of medicine. Remember you, Dad, be sitting there tape, man, I take 5 medicine. I take medicine with my so-and-so, my so-and-so, my so-and-so, my so-and-so. Then your auntie will come, she gonna outdo her. Wait a minute, you got a boat hold my bill. I take 8 medicines. I take so-and-so, 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 so-and-so. And I used to be like, wow. So, nobody's promoting wanting to take a lot of medicine, because I used to be thinking like, dang, how much can they be weaned off of? But what we're saying is don't overlook stuff and then talk out of both sides of your mouth, because a lot of these people aren't taking the vaccine, aren't wearing masks. They really doing all these herbal things. And then every time you ask them why you're not going to do it, they got another excuse that they term a reason.
Veronica,
So they don't want to take medicine, but they don't want to take medicine, but then they don't want to do. Look at the hospitals. They're not doing the traveling nurses anymore because they're running out. They're here, they're there, they're everywhere. They're having to bring the military to Louisiana, the military to Tennessee to help with things like that flooding and stuff that happened in Tennessee, and to also help with COVID.
Okay, let me read what Snevella said. She said, "This is very different. This COVID is something that was man-made to kill us all. When people pay you to take the shot, and give you days off, it should make you think something is wrong."
It has made us think that, but what can you do about that? It's a lot of these theories and things that people have come up with that 666. People are throwing stuff out there, and when people don't want to do something, they grab on anything that's negating what's being obviously seen. What we obviously see is a healthcare system that's overwhelmed, and even rooms are being made in the emergency department. And then when stuff like that happens, you badmouth the hospital, talk about how bad they are. Some have been bad before this happened. But if they don't have the rooms, they have to put you in the ICU, or they're making makeshift hospitals on the outside. Is man-made. What can we do about it besides try to take the vaccine? I was one that did not want to take the vaccine, but I'm sitting here looking at what's going on and what it's doing. And the healthcare system is being overwhelmed. And these people that are coming up with these reasons, they don't have the first medical knowledge to say, well, okay, let me go to work in the hospital and take care of these people because I don't believe in all this stuff. It's man-made. So I go to the hospital and work.
It's no different than putting on sunblock, saying you want to prevent cancer. It's no different than like I used the excuse or used the example of saying going into the woods and putting on off to hope you won't get bitten by a mosquito. These are the
some
same.
People still gonna get bit. And some people might have a bad reaction from the bite.
That's
correct. The first thing you'll get naysayers to say, well, they use that off and they still got bit. I ain't gonna use that off.
That's right.
The sad thing that I'm talking about is, especially with these home remedies. I was at the barbershop last week, and they were talking about a guy who contracted COVID, and he didn't want to go to the doctor or anything like that. So he went and took, and I don't know if y'all heard of it. It's called Many Weeds tea. I don't know. Have y'all ever heard? Have you ever heard of that?
I think I have, but go ahead.
Many Weeds tea is an all-home remedy that they used to give way back in the day. And it consists of cow chips or horse chips that you put in boiling hot water and you drink. That's why they call it Many Weeds tea, because horses and cows eat many different types of weeds.
Mm-hmm.
And he has put it in his mindset that he feels better now.
Since he took that Many Weeds tea.
Yeah.
I believe in the lime, the vinegar, the thyme, the turmeric, all of that stuff. I do believe that stuff helps you. But when it comes to a point where that stuff can't do nothing for you, people have to go to the hospital. Or if you feel a little better, like people who have gone to the hospital that had COVID, they've gotten released, and they're still having these long after effects.
Well,
how long do you think all those other things are going to help you? Yeah, the medicines that we take for everything else are man-made, synthetic, and chemicals. Yes, some of the herbal of it comes out of the jungle in the forest, some of it from Africa. But when they make it, it's man-made. Your blood pressure medicine is man-made. Your glucose medicine is handmade. Your thyroid medicine is handmade. Most of it has something synthetic in it. There's very few medicines that don't have something that's man-made in them. And even if they created this, why was none of these people telling us this 3-4 years ago then when they say it was happening? Why was nobody saying, y'all know they coming up with so-and-so, they like to spread word of mouth, and why was nobody saying this? Why is it all of a sudden now that they're willing to listen? Somebody's putting that out there. Why are so many people willing to listen to that? If so, question those people, why didn't they tell when it was happening? Why didn't they tell it when they found out? that it was going to happen 4 years from now, 2020, 2019, 2020, there would be this, there would be that. Why didn't they tell it then if they knew it? Everybody is telling it now. Why didn't they tell it then? They're coming up with something, y'all. And you'll get somebody that calling you right now and say, they worried but nobody listen. Well, why didn't you listen and spread it? Let us know about it.
I want to say hello to my good friend Kathy Davis. She's chiming in. Stavella, LaShonda Harper, all of you all that's chiming in. Tammy.
Kathy, you had something that you wanted to say?
No, sir. I apologize, y'all. I had to take care of some business. I missed probably a good portion of what y'all were just talking about. Can somebody recap?
Well, it's basically, the debate. Basically, this is a debate. And it's a debate among blacks, whites, but no one, are the Mexicans, are the Asians, are they debate? I'm talking about the American Asians and the American Mexican Hispanic. Are they debating about to take the shot or not take the shot? Or is they, amongst us, as far as African Americans go, you got some saying, I'm not going to take it regardless. And you got some say, hey, you better take it or you need to take it. I'm a true witness to a member, a family member, a friend that have died from COVID-19. I am a living witness to someone that has made it through COVID-19, but they didn't have underlying conditions. They didn't have kidney failures or lung problems or anything of that old nature. So they fought their lives, or their body was strong enough to fight back to reality. But guess what? Every one of them I talked to say they still experience a little different something in their life that don't seem normal. Medically, I'm saying. And I don't know.
And if it's man-made and if it was designed to happen, what do? Do you sit there and continue to say that? Or do you, and looking at a healthcare system that may not be able to take care of everybody in the system? Or do you say, well, the one's going to get it, like the conservatives did at first?
Pretty much.
The one's going to get it, and the ones that don't.
That's right. Pretty much.
And that's why I say I am all for the herbs and stuff, because a lot of people have had pre-existing conditions and they came out fine. A lot of them try their best to be healthy because they had other things, high cholesterol, other things going on, and they try already to be healthy. Some of those people came out okay. Some of them, like Darryl said, had some residual, whether they were healthy or whether they had pre-existing conditions. But some of them came out okay. And then some of them said that they think it was because they took the vitamin C, the zinc, the vitamin D. So I'm not against the vitamins and the herbs at all, especially with the exercise, because I think it helps them to develop a healthier immune system, or it at least allows them to be able to fight, even if they do have pre-existing conditions.
Let me see, can I get LaShonda to call in? LaShonda call in. She said, I feel strongly about this vaccination because I caught it and was very...
LaShonda, that's what I was about to say. I didn't want to say that because that's her story to tell, but she is one that has had it, and people still don't even listen to the people that had it. But all we can do is get them to give their testimony. Continue to give testimonies.
I was in ICU, very sick. If you don't take the vaccine for yourself, do it for your children, your grandchildren, your mother, father, family, and friends. Save their lives. That's LaShonda Harper.
Because many people are asymptomatic, but it still does not mean it's not being spread.
And see, those are the ones who actually spread it the fastest, if you ask me, because they don't know they got it. Once again, we got all these asymptomatic folks coming out. It's gonna get ready to go to every last one of these super spreaders. Brown Bear Stadium hold over 100,000 people.
Mike, we're gonna call it super spreader.
Get 100,000 some people. It's not gonna be at Brian Denny Stadium at every game this year.
Look, Mike,
some people you just cannot get to, and we are seeing stories every day where people are asking, can they get the vaccine? At UAB, they're telling them, if unfortunately at this point they cannot get the vaccine.
And at the same time, Veronica, don't forget now. What about when the people say, "Oh, I'm finna go take the shot," and now we short of the medicine? What's gonna happen then?
Mm-hmm.
At
first,
I
wonder what's gonna happen. And right now they have it. Even Joe Biden had to suggest that right now Alabama is one of the states that's using that monoclonal antibodies, because if you're within so many days, Don't go when you see your symptoms. If you test positive, don't wait to see symptoms and say, oh, let me see if it's going to be a cold. If you're one of those people that test positive and you're not having symptoms, Dr. Perrin said it is offering treatment. Dr. Joe Biden has said the monoclonal antibodies have been made available. Please go get them. Because if it gets so gone, once the person gets past a moderate stage, they don't give it to them.
Nah. But they say he also said, and Dr. Fauci also said, don't use that as an excuse not to get the vaccination. Because the vaccination causes you to get the antibodies naturally, and that's better than them trying to give you the antibodies.
And if you're willing to take the monoclonal antibodies, which didn't just fall out of the sky, they've been dealt with by man. Why not be willing to take the vaccine?
Let me give Shonda the number right quick. Put the number up. It's 205-310-6067. 310-6067. That call Mike number line, and that'll get you straight in with us. 310-6067. That'll get you in contact with us.
But I plead for we had somebody call in a couple of weeks ago because I asked were they willing to cook or have they clean up their house and spray Lysol around everybody and everything all the time, and they just not going to take the vaccine.
Right.
And they said that they're going to be like this for the rest of their life because they've been a nurse for this many years and they just not going to do it. Right. And I commend them. But my question is, how many other folks is going to do that exact same thing? I mean, everybody be walking around with a can of Lysol, and every time they touch anything, they got to spray their hands and wipe their hands off. And
it almost makes everybody want to, though, Mike. Like you said, everybody, but those of us who are willing to do our part, it makes you want to.
You got to. It's to the point now you got to walk around with hand sanitizer in your pocket and a can of what they call it, Lysol and the other band stuff, and gloves.
Microban.
Yeah. And we got to start. You know what? It's to the point we got to start wearing latex gloves daily. I'm sorry. It's like because our customs. I met a guy today. And we just so accustomed to just shaking hands because that was just a respectful way of doing things.
Mm-hmm.
But I was giving the fist bump. He reached out his hand. Once he reached out his hand, my fist released into the handshake. So, You know what I'm saying? Mm-hmm. So we immediately just transported a hand. You know, I don't know where he been. He don't know where I been. And I mean, it's all part of that.
Mm-hmm. And again, Ms. Temple just stated you still have to wear the mask with the shot or without the shot. That's what we addressed earlier. The mistake that the CDC made was telling people that after that second vaccination not to wear the mask. Don't y'all know that there's half, and they should not have done that because we're still learning it. Just like the thing on saying professionals are still learning it, but researchers are still learning it. And what they've learned, and it's really hurting us right now because people are throwing all this out there. Well, you can still get it without. The virus is not designed, like the third time we said, and we say it all the time, it's not designed to kill it. It's not designed to stop it. It's designed to hopefully prevent severe illness and to keep the people out of ICU and allow other things that other people maybe have been going on being treated.
We got Ms. Temple on the line.
Is that Ms. Harper?
Yeah.
How you doing?
Yeah, go ahead.
Hi, how y'all doing?
Good.
Hey, Shonda.
Hey.
Wanted to hear your testimony. I mean, you know, like I was saying earlier, it's a debate. I mean, people that had it and some that haven't had. I haven't experienced it, but I've seen the results of it. Maybe you can say something to change a person's mind tonight. They say, "Hey, I'm going to get vaccinated." Could you explain?
Right.
Could you explain that? How about the COVID feeling?
Yes, I was one of those persons at first that was very hesitant about getting the vaccine. I was not going to get it at all. myself and my sisters, other family members. But and I was one of the ones that was a cleaning fanatic even before this virus. Um, spraying, wiping down, and everything. And I got it and couldn't understand why and how because I thought I was doing everything that I needed to do to prevent myself from getting it. But as I said, I caught it. I was my sister. Both of my sisters had it. Myself ended up in ICU. My middle sister didn't have it as bad as myself and my baby sister. She had it really, really bad, and we thought things were going to turn for the worse with her. She has a family, a son and a husband. I have, children, grandchildren, and they all have underlying conditions as well as myself. So until we got it, we was in that mind frame as well. We're not going to do it. In other words, we were being a part of the problem and not the solution. After, going through what I went through in ICU, it took me. I got it first week of December of last year, and I suffered with it all the way to the middle of March. And when I tell you, still today, I still have complications from it. Can't hardly walk 5 minutes without getting tired from my living room to my kitchen, out of breath. And it's scary. So after we all had it and experience went through, I'm not gonna say everybody got the vaccine because we're still trying to get family members to take it. They keep saying we don't know what's in it, this and that. Well, we take all these medications that the doctors and everybody are prescribing us for every other ailment that we have. Do we really sit down and see what all is in these medications? No, we don't.
No.
We're taking
everything. Half of them.
Right. And it's just like a lot of people say, well, I trust in God, and God is, yes, I trust in God as well. My faith is just as strong. But God gave you 5 senses that you need to use, and along with your faith in Him. And it angers me to hear people
It really
say,
does.
That I'm not going to take it. But they want to fly to your house, and then they feel some type of turn them around. That's just foolishness is what it is. And I'm not trying to sugarcoat anything. It's just foolishness.
And it's not that nobody's downing anybody, but like you said, LaShonda, God gave us 5 senses, plus we trust in Him, and He gave you common sense, and after born, God gave us sense. You got about 8 senses you're working with.
Right. And if they told the majority of us who are saying, I'm not taking it, it's just something they put out there to kill us. Okay, if that's so. If they're saying that, they're not saying it's going to cure us or not kill us, but like I said, we take a chance with everything else. I don't trust the federal government. Well, the federal government issuing out all this money, and if they say, okay, we're not going to send you this if you're not vaccinated for your children, you're not getting your children vaccinated, the ones that are old enough. If we don't stop sending all this stuff, how many of you would fly down there and get the vaccine then?
That line would be so long.
Hey,
You say they said they finna send you another stimulus check, but you got to come up there with a vaccination card to get it. That line will be so wrapped around, and folks will be there happy and smiling.
That officer from Northport will be getting fired.
But it's coming to that. Are you willing to lose your job? Because all teachers in the state of New York have to be vaccinated because they're looking out for not only themselves but people's children and whoever these people going home to their grandparents and their parents, their aunties and whoever are watching over them, keeping them when their parents are at work. So if you work in the healthcare field, because there are a lot of people in the healthcare field who are woke as well. So if you work in the healthcare field, are you willing to lose your job if your state or your mayor or your governor says you have to make $45 an hour, that you don't have a place here if you can't be vaccinated? And that's where you live, that's your home. Are you willing to uproot and move to another city that allows you to work with just getting tested every other day? Some may be.
You know what? I don't know, because Texas had a lot of healthcare people that quit. And
but see, Texas has a governor that's basically backing that type of thinking. Now, though Kay Ivey is not planning to make any more mandates, she doesn't back that type of thinking. So I think she will do something. I think there are things that she will do. I don't think she's as bad off as far as her thinking as Ron DeSantis of Florida or Gregory Abbott of Texas. Mm-hmm. Don't know yet because, money speaks, and whoever funded them campaigns, big money speaks. So you really don't know yet. So we understand all this stuff about the government has a hand in this and the government has a hand in that. When have we ever been able to trust the government?
Right.
But we still taking medicines when we need it, got our kids medicated when it was needed. And anybody that knew about this, that foresaw this or knew that it was going to happen, why did you not preach it to the skies?
Yeah.
Why now?
I want to go back and touch on something because I think the conversation went, if they bring a vaccine card, would they accept them? If they were giving out money, would they, how many people would go, and which would bring up a totally different thing because you're talking about fraudulent people coming out now just to get that check, but still won't be vaccinated because, I'm understanding they selling vaccine cards on the internet.
Yep.
Oh my God.
Yes. They're falsifying documents.
They have. A couple got arrested in Hawaii. Hawaii is not playing. Yeah. And see, like she said, that way to go, Florida. Okay, that same Florida, that same Trump following governor has a lot of things up his hat for people of color too. So it's no way I'm saying way to go, Florida, or way to go none of these conservative people, because it's mostly the conservative state that are promoting this propaganda of saying don't do this, don't do that, but behind the scenes they've taken it.
Right.
It's like some of these athletes that won't say if they've taken it or not. I can understand them. Sometimes you get to the point of privacy, but what's happening, and it's starting, and usually things like this start in the bigger states, the more populated states like New York and California, they're starting to say you have to have proof. And if you want to go down there with that fake proof, if you want to, and they find out, you will be probably arrested.
Oh, yeah. No doubt.
Because what you're doing is you're putting yourself out there saying you had something that a pandemic they're trying to control, but you're out there and you're unvaccinated.
Right.
But you're saying that you've been vaccinated. And people who I got friends and family in New York right now. They upset because a lot of them are afraid to take, and like I said, as African American people, I understand with the history of medicine. Why? I understand why. That's why I don't bash people as far as the why. But this is not a African American thing. It's African American. It's Caucasians. It's everybody talking about they waiting. So you're that selfish to wait to see what it does to somebody else. But then you got people in the healthcare field that's going to try to help that somebody else, you, and whoever else that comes to that hospital. Right. So if you're not willing to take the vaccine, okay, you're fine with masks, okay. But so many, like see on Facebook, aren't wearing masks. But what happens? Are you going to go to the hospital then? Mm. Are you going to go to the hospital when you selfishly didn't do either? Are you going to the hospital? God forbid.
I saw. I was looking at an event that came on this past weekend, and it was 52,000 people at this event, and they had people on. They were wearing masks underneath their chin, but they were hugged up around each other, trying to get in front of the camera. This is the stuff that's going to get ready to happen on a consistent on every weekend. As a matter of fact, every Saturday, every Friday, Saturday, and Sunday.
Mm-hmm. Well, Mike, you can look at this point from this point of football starting to December 31st. You're going to have a lot of gatherings that are going to be astronomical, man. You know, how you going to stop people wanting to gather? Now, they've been out of touch for a year and some change now. So you're talking about gathering for football and sporting events. Then you got Labor Day coming up, and then you got Thanksgiving coming. You know, a lot of things. If we don't try to curb it now, you can still run rampant, even with these other variants. Because I'm pretty sure we're talking about the Lambda. If it's mutating, who's to say what we're gonna end up with?
And see, that's what people keep saying.
Okay. The thing is that once, and y'all remember,
it's mutating because basically we're fighting it.
The numbers started going up after the 4th of July. Before that, the numbers were going down. I think DCH had less than 5 people.
Mm-hmm.
For a long time.
For a very long time.
And that's when people the vaccinations were on the rise.
Everybody had went out. They went out of town. They did all these huge gatherings. The CDC had just said, hey, if you had the shot, you ain't got to wear your mask. And then you had all these other states that came out and said, hey, we're not going to ask for your card. We're going to go on the honor system. So now people are like, well, I'm not going to wear my mask. They can't ask me if I got a card or not.
And if they ask me, I can just say I had it.
I got it. Yeah.
But Shonda, is Shonda still on?
Yes, I am.
Shonda, okay, after you got vaccinated, how did it make you feel? Like, did it, because that's what a lot of people saying, you don't know what that shot's going to do 5 years from now. And we don't. So that's why I always say I understand the reluctance to take anything new. But those mRNA vaccines, they have been researching and studying them. Like they're saying they didn't know about this virus going to come out. Well, they've been studying these types of vaccines forever. But this is the first pandemic to hit like this since 1918. Right. So even if they did know about it, well, they've been studying these vaccines for other conditions as well. So when you took it, how did it make you feel sick? I mean, because that can happen with the flu vaccines. And some people say they'll never take it again because they felt like they've had the flu. But usually a vaccine may make some people feel bad. And some people it won't.
Actually, when I got the first one, my arm was a little sore to touch. I didn't really know that it was sore unless I touched it or somebody asked me, well, is your arm sore? And twins, they're 12. They got that when they started giving the 12-year-olds. And the same thing with them. They didn't know their arm was sore unless I asked them, and they touched it. They were like, oh, yeah, it's a little sore. I felt just a little tired for a couple of days, but I, rested and relaxed. And after that, I was fine. The second one did nothing to me. I mean, I was superb with it. And so were they when they got their second.
And see, I understand when people say, well, so-and-so said it made them feel like this, it made them feel like that. But, some people maybe never took the flu vaccine, and sometimes they don't take it. They'll take it one time and make them feel bad. They won't take it again. But usually a vaccine is training your body to act like it's seeing the whatever the virus is. And that's why some people will have, those feelings. Mm-hmm. So I just ask people to look at what was going on when the numbers were saying 5 at DCH. And it was before Delta came over here. And, and so I won't even say that it's because of a lot of the things that we did in the United States. We're not the only country. So it was other people that never got any type of assistance with the first one, with the C-19. And so that's when we were just getting the vaccine. Some of those people, so that's when it was mutating. Yeah. So all we can do is kind of pray and, honestly, watch our borders, watch who's coming and who's going. And that's not a racial thing. That's from everywhere. That's from across the seas. That's just not from Mexico. You had a man in Texas, the Attorney General, blamed the increase on African Americans, saying because they refused to take the vaccine. You see what I'm saying? That kind of racist thought. And then to say that's their choice, go them? No, because he's blaming the increase on Black people, just like the one in Florida blamed the increase at one time on Mexicans.
No Mexicans, sure did.
Everything is always the people of color's fault. And then here we are trying our hardest to get people of color to just listen. My thing is, I understand the fear. I didn't want to take no vaccine. I didn't want my family to take a vaccine. Like Shonda was saying, it's new. That's the first thing to hit everybody. But when you start watching these hospitals fill up, and you start hearing people say what happened to people, or we start seeing what happened to people, it's like Daryl said, do you take the vaccine? Do you not? You wait. You try to weigh the scales. You put your faith in God and you do what you think he gave you the common sense to do. And if you're saying that he's telling you not to take the vaccine, then God be with us all.
Yeah, here's the key to what you just said. You have faith in God, but God even talks about faith without work. You got to do something about it.
Work.
There it is.
You got to do something about it. You just can't say, I trust God. I got faith that, yeah, but what are you doing? And see, I think we've migrated from the basic principle of how to maintain or at least keep yourself from being catching it. And I thank God for Shonda, I guess that's her name, her coming out of that. But if, I don't hear them talk about washing hands, sanitizing your hands, staying 6 feet from people. We talk about masks, but we don't. When we initially started, it was all of that.
You go up in the stores and they want to stand all over you. Then next you look behind you, somebody, and I'm like I said the other week, everybody got a person's face anyway. Should have. You got a person's face anyway. And now it seems like everywhere you go, somebody's trying to infringe on your person's face. Look like everywhere you go, somebody want to reach over you, stand over you, breathe over you. Just infringe on point. I ain't gonna lie, y'all, because this attitude is a whole different attitude sometimes in the streets. You would not reach over my child when she at Walmart. I don't care if she's 30 years old. You would not reach over her knowing this going on. You not got on one mask.
Not one.
I don't lay hands. I don't put hands on people, but I'll push you up off my door.
I want to go to Walmart where you and I want to see you throw a bullet at somebody.
A whole different demeanor. Whole different demeanor.
But let's look at the pressures. Let's look at the pressures that this COVID is causing, though. We're looking at the fact that, okay, we're talking about human beings, right? We're talking about teachers, nurses, doctors, police officers, firemen, sanitation workers, all levels of people. There are possibility of being exposed to this COVID-19, and there's all levels of people that don't even wants to take the shot. Well, someone mentioned earlier about being, Stavetta said they're paying people, the hospitals are being paid for people to, I guess, distribute the shot. Well, the government sent out money, and I'm proud to say $250 is not for enough for the city employee. But anyway, they're giving each city employee that took or has already taken or will take the COVID-19 an additional $250. We said that months ago that an incentive back here when Ohio was doing a lottery for a school scholarship. New York,
one won $2 million.
Right. So this is something that the government had already sent this money out for that. We've already got stimulus checks to try to maintain your living conditions. But the middle class, or should I say the lower poor class, or should I say the upper poor class, that's what I'm going to call it, because there ain't no such thing, ain't no middle class no more. The upper poor class is the one that still got to go to work, still got to pay the bills, and they're still being left out on, you're not eligible for a food stamp, you're not eligible for a stimulus check, you're not eligible for this, but you still got to go to work and make sure that you can maintain your livelihood. But what happens when that person get wore out? That fireman, that police officer, that nurse, that doctor, when they get too tired to even continue to go, who's going to take those positions then?
Because the system is overwhelmed.
How dangerous is it for all those people that you just got through naming, Daryl, to be working exhausted?
It's very
what I'm saying? An exhausted firefighter trying to go up into a house might make mistakes during a fire, and then that's going to cause, injury and harm to himself and maybe someone else. The same thing with an exhausted police officer, an exhausted nurse, an exhausted doctor. All of this right here is dangerous even to the patient. Not only just to the patient, but to the people who are actually doing their job.
Patient,
public, it's a such thing as sleep deprivation. Ronnie, you know what I'm trying to say. I don't know.
It's sleep deprivation. But even in spite of all that, though, like we were saying, some places are going to mandate those positions to do it. Who's going to be the breadwinner when Jay's been the breadwinner for years, taking care of their children and their families?
Kathy Davis say when they get sick. Kathy, call in. I think you're in the nursing field. Matter of fact, I know you're in the nursing field. Come on, join the conversation. I mean, I'm not trying to change anyone's mind because it's people still walking out here without insurance, life insurance.
And there's no need to change people's minds because it's like they come up with excuses for everything. And some of the excuses don't even correlate with the situation.
And the first thing a person say when they say they ain't got no life insurance, well, I'm gonna die. Somebody gonna put me away anyway. Well, why I gotta do that? Why we gotta be the one to do that?
That's so selfish. That's so selfish. But if I have a friend who didn't know that her and her children had the virus, and went around her mom, thinking they were fine, and when he got tested and ended up having it positive, her mom got it from them, and she died. And let me tell you, my friend is wearing that on her every single day because she's, blaming herself for giving it to her mom, and her mom is now like, it's just, that's why I say if you don't do it for yourself, do it for your family members, your children, your friends. Don't be selfish.
Right.
So I have to watch this, and she tried to hold it in, but I know it's hurting her. It hurts her all the time.
And that's the thing that we were talking about before we actually got on the show, and actually me and KP was talking about it too, was when it started hitting real close to home is when you want to try to start doing something, but you feel a certain kind of way because you could have been doing something a whole lot sooner.
Right.
Exactly. LaShonda, I can relate to what she's going through. My mom never went anywhere.
Hey, we got Kathy Davis on the line.
Okay. Kathy, how you doing?
Hey, I'm good. How are you all?
Great. Come on, talk to us. Tell us what Hey, you're in the healthcare field.
Hey, how are you? Yeah, I think the nurse that you have on there is, doing a really good job of answering the questions and conversing with you all about it. The only thing that I can add, and I did have the vaccine myself, and some of the symptoms and all that you all are talking about, with the sore arm and all that. I did experience those things too, but working in healthcare. The one thing that I can add is that because people are not being vaccinated, the systems are overwhelmed. What I'm seeing happening is a lot of our staff, they're coming down with the virus. So if you don't have the staff there to provide the care when the patients come in, you're not going to be able to get the quality care that you need because you don't have sufficient staff. And that's one of the main reasons why, they're really encouraging people to get the vaccinations because you don't want to wear your staff out.
You can't. Exactly, Ms. Davis. Exactly. We've been saying that for weeks. And it's like those people who are going around making an excuse every time. I'm like, are you experienced in working in ICU? Are you experienced in even working in geriatrics? Are you experienced in giving shots when the hospital staff says, you know what, I'm done? Because some hospital staff have decided not to return to nursing. Nursing has always been short. But some people have decided not to return because they feel like people on the outside are too selfish to get the vaccine.
Right. And that's why, it's just so important, that people do get the vaccine. And I did hear you all talk about, having the virus and it not, really being active because it can live in your nose from what I understand. You're not having the symptoms and yet you're spreading it.
So we still should be wearing masks.
You should be wearing masks. You should be washing your hands and taking all those measures that you all have mentioned. But I think the public really needs to be aware that, the help that you need is just not going to be there. It's really not there because I don't want to say where I work or anything, but I know for a fact that staffing is short because the staff are being affected by this virus. So it's very important, I can't tell anybody what to do. I was reluctant about taking it initially, and I waited. I didn't take it during the first round. I waited for the second round, but because I work in a hospital and I wanted to protect myself and my family, I went ahead and I took it.
That's the
And I
reason why I
think
took it.
everybody,
Hmm.
I think everybody had reservations about taking that vaccine in the beginning. I know I was right here on this show when I said personally that I was not going to be the first one to take it. I have to see what was going on. But it was not far after that when I decided to go ahead on and take it.
But let me say this.
At the same time.
Let me say this. A lot of the reasons why people are not taking it, their reasons are based on myths and not on
Hmm.
fact.
Yes.
So, and I would tell you with any vaccination, with any procedure that you're getting, get informed. Be informed about it, and make sure that you're getting your information from reputable sources, from scientific sources and resources, and not, the internet or what your friend is saying or what, your mom or brother said and all this, um, don't do that.
Hmm.
You know,
Some people will spread misinformation because it causes a frenzy.
Mm.
Because
right,
it's out there that they said this and they said that. Some people will spread
right.
misinformation. And then the thing about, everybody that passed away, they list COVID, even pre-COVID, when whatever the diagnoses were listed. So some people are on this thing about they're going to say it's COVID because they want the money. What do they think Medicaid is all about? What is All Kids all about? What is
Right.
any billing service that has to do with medicine? It's about being paid. It's not just with C-19.
Absolutely.
So since the Pfizer has been FDA approved, do you guys think that a lot of people will change their minds now about being vaccinated?
No.
I don't think so. I think some will, but I think some of them was using that as an excuse. They were saying, "Oh, the FDA, when they approve it, it's not even FDA approved." Well, guess what? CDC, y'all listen to them until they say what you didn't want to hear. Anytime they say something that's opposite to what they really want to hear, they're not going to do it. And a lot of those that said it, some of them have said that they're considering it now or they will. But a lot of them, even though the FDA has approved it, like we were talking about other sides, the FDA hasn't approved a lot of other stuff that y'all take what you do. So now that the FDA has approved it, what are they going to say now?
Mhm. Mhm.
It's gonna go back to. It's gonna be that old.
It's still new. Mm-hmm.
It's gonna be
whatever other thing they can come up with.
I'm gonna take it. I just ain't got. I'm gonna wait till I have some days off
Mm-hmm.
because I know I'm gonna be sick after I take it.
A lot of things.
I've heard that so many times. I can't even tell you. And I was like, man, really, you're probably not gonna be sick like that, but. You probably have a little soreness in your arm, or something like that. Some people can have a fever after the fact, but once again, I personally, it didn't do anything. Like, I take shots every day, but it didn't do anything to me. So, Daryl said it didn't do much to him. He had a little soreness.
Yeah, social.
And that's with most vaccines. Your arm is going to be sore.
Stop you from doing what you want to do. That's all I'm
saying. Let me ask this question to Kathy and Veronica. In relations to COVID-19 is now recreating our healthcare insurance policies and HRs throughout America for a job. Should they give it that if a person takes the shot, that if there's a bona fide reason that they're having side effects, that they should be given paid leave from their job, or should they, and this goes along to the fact that if they decease from the position, should their insurance if there should be any kind of what they call amendments in the insurance, or do you think it's going to change the way insurance death policies and stuff goes? Do you see that?
I really don't know, but I kind of don't see that. I kind of see it as, with any other vaccination, and you don't see that kind of thing. When when you're given a measles mumps the MMR, measles mumps, rubella, you don't see that with any other vaccine. So I don't see that, and
So,
I don't know what harm that.
So Darryl, are you saying like if you receive it, will they give you paid time off to recuperate or?
Right. Let's take a teacher, for example, that might be in the school, comes in contact with COVID. From my understanding, there's policies somewhere on the books that if a teacher or a staff member comes in contact with COVID that hasn't been vaccinated will not be going to have to use their own personal time. But those that have been vaccinated.
Now you mentioned two things. You're talking about the personal time from the hospital, and
sick leave. I'm talking about like sick leave from a job. Your insurance.
Okay.
Sick leave.
So I think he kind of meaning like just change the game in general, overall, as far as with work, as far as with jobs. Maybe they medical or not. Is that what you mean?
Right.
Just kind of change the game in general.
Right.
Well, at one point with the flu vaccination. If you go to work and you don't have you can't show proof that you had the flu, they will make you wear a mask. I feel like so many people are talking about their bodies and this and that, and I believe that. Just like I always say, those people who are anti-mask want to tell women what they can and can't do with their bodies. So that to me, that's a no. But as far as like with jobs, since you can't really tell or pinpoint where you got it from. If you go to work and they say, well, you have to take your own time, I don't think there should be an issue with that. If you go to work and they've asked you to show proof that you're vaccinated and you don't, or you won't, or you say you're not getting vaccinated, and then you ask for time off, I think that should still allow you the usual vacation time, sick time, paid time off that you have if you have it accumulated. If you don't, then you have to just be off, and hopefully go back to work before missing the whole check. As far as that kind of stuff.
That is happening. That is happening. When a person becomes ill with it, they can take their time off, as with any other illness. Now, when we first started taking the vaccine, during the first couple of rounds, so many people were having some of those side effects like the sore arms, and some people for about 24 to 48 hours were feeling real sluggish because I felt like that. Mm-hmm. Mm-hmm. And we were allowed to go home, and throughout, I think pretty much throughout the hospital, they would give you that time off to recover from it and get back in there. But as far as insurance policies, if I understood the question, I think I heard something about that. That's the part that, I was speaking to when I said I didn't know, how that'll end up going.
Yeah, I don't know either. I feel like, anytime you try and get insurance, they want to know all of your medical history anyway, and sometimes that causes them to inflate the price of it. So I think it's still going to be that way, at least until we get enough people to understand that. Like some people are saying, it's not going to go away. So at least until we get a certain degree of herd immunity, that it's not so bad. I think that maybe as far as on the job, whether it be teachers, medical, and everything like that, they may ask still, have you been, vaccinated? And if they say no, because this was the result of a pandemic, they may say, well, you can't be paid, but you can be off. And so, and then they make it to, and I think that would change, I would hope, because if it's going to stick around like they're saying, then people will need to be off, and they should just be able to use their time as usual. Right. And it's, and as far as like the hospitals and billing and things like that, well, they bill based on what's going on with people anyway. So, I don't know. I'm like Ms. Place, I really don't know what type of changes they will make. I think everything, they're trying to get it to a level of some degree of herd immunity so that it could be treated like every other illness.
Okay. That makes sense. That makes sense.
I think that's what I think it's trying. I think right now it's just everything's so up in the air because we thought we were getting to a point of normalcy, and now these other variants are coming about. Like I said, and you can't just blame everybody for it because they're different countries. And once it hits one country, it's coming to it's going to other shores.
Absolutely.
So yeah, I think at one point, whenever it becomes to a point where it's like herd immunity, like there's some people that still get measles. Very few. There's some people that still have breakthrough chickenpox, and they've had the virus, or they had chickenpox before. They developed the vaccine for shingles that they didn't have. I don't see people in an uproar about taking the shingles vaccine. Shingles is in the same virus family as chickenpox. If you never had chickenpox before and you never had the virus and you come in contact with someone with shingles, you could possibly get chickenpox because they're that closely related into the same same family. But there is a vaccine now for both. There's one for chickenpox and there's one for shingles. I didn't see anybody having this big uproar. And they recommend the shingles. What is it, Kathy? Is it 50 and over, 65 and over? Something like that with shingles. They recommend getting the shingles vaccine. I don't see people ranting and raving about that.
Right.
And I understand that everything is so different about C-19 because there's a pandemic.
Yeah, I think that just politicized it so that
right.
That's why. We're hearing so much and all the pushback and all of that because of all the politics and, that surrounding it.
You can actually look at the numbers of people, like we just talking about Alabama, for instance. And I think Alabama is sitting at like 36% vaccinated. And it's more like the predominantly white people are not vaccinated. And not trying to get vaccinated here in the state of Alabama. But we're having more and more black people who are trying to do it. And a lot of times you kind of say, okay, we talking about Republicans and Democrats. Not saying that there are not any black Republicans and white Democrats, but that's like the divide here in just this state alone. Not talking about Mississippi and Georgia and even Florida. Or who has gotten the vaccinations and who has not gotten vaccinations. But everything about it is so politicized that it's like right now we're talking about human race. We're not even talking about
right, absolutely. Right. Right.
And it's
well, y'all, I've got to get off.
Okay.
I really enjoyed talking to you all. Thanks so much for inviting me on there.
Thank you.
It was nice talking with you ladies, and I'm so glad the lady who had it. I'm so glad to hear that she's doing well.
Great.
Thank you so much.
Nice talking to you.
All right, y'all have a good night.
You too.
You too. Bye.
Bye-bye.
Thanks, Kathy.
You're welcome. Bye-bye.
Miss Kendrelyn Merriweather chimed in. She said she agreed with the herd immunity. Hey, call the number if you'd like to join the conversation, 310-6067. Kai Porter tried to come in. What it is, Mike's number is more open. I don't know what kind of system he got, but when I have to click over, I take out everybody's voice. So,
I don't know. It's something about Kai Porter's phone that for some reason it don't ring on my side.
Okay, and that's what it is. It's when I have to pause and click people over, then I clear out everybody. You can't hear Mike. You can't hear anybody until I merge everybody, and then I can only hold up to 5 or 6 conference numbers. So if you like to join,
I'm saying the same way.
Okay.
I usually catch y'all while y'all in the middle of talking when I catch that phone. I didn't got kind of good at it.
Okay, well, good. You good at it, Mike. You good at it. Great conversation. Once again, Ms. Merriweather, if you'd like to join the conversation, 205-310-6067. That'll get you in contact with us here on the program. Great conversation. Society is going to change. There's going to be some changes into society with this COVID. We're going to have to live with it. I don't see no forecast of another worldwide shutdown. I don't see that. I don't hear that. I don't even think.
I don't think it's going to ever happen, Daryl. But I wish that on a federal level, it'll be a federal mandate.
Nope. It ain't gonna happen.
Yeah, because you have.
I'll say just like I'm not sure as far as what changes will be made as far as people's day-to-day lives and work and stuff like that. I don't know because with the numbers doing what they do, we don't know.
Hey,
I understand exactly what Kay Ivy was saying. Like, what's this user mandating something and you can't enforce it, and these folks doing what they want to do anyway. They ought to have common sense. That was one thing that I did agree with her when she said that. Period. You know what I'm saying? Like, you see people still getting sick out here, and you still want to run around without a mask on.
Yeah, it's Facebook. I see Facebook posts with people saying this happened with them as far as with race of COVID. You know, people still making laughing emojis about it. Like somebody, some mystical wizard or something made them the be all and know all, and they over every hospital, and they know that every lie that's being told, every truth that's being told, and it's only because it's what they don't want to believe or whatever they choose to believe, and they sit there and they literally laugh at people's situation when it relates to C-19.
Wow. Kendra Merriweather said, I heard someone say earlier to get your information from reputable sources when making your decision to vaccinate or not. What if your primary care doctor tells you they haven't, nor any of their family, including their elderly mom, has not and will not take the vaccination?
I changed doctor. I'm sorry.
Wow.
I can't come back up in there.
Just like with anything else they tell you that may be really questionable. You know, like you said, get it from a reputable source. But there are some doctors that are spreading these theories and stuff on YouTube and places like that, going against what the science is saying.
But you know, they can afford to seclude themselves. They're not saying about, okay, mom is in a whole different section of a home. They homeschooling their kids. Their food is delivered. Right. They don't go anywhere. The only time he goes out. And when I went to the primary care, I understand. I noticed the precautions that doctors and nurses are taking now. It's like, okay, you can come in, but we really want you to come in if it's just necessary. Well, to me, I felt like, hey, this is necessary. I ain't coming here to just get a COVID-19. You're not going to file just a COVID-19 test on my insurance. I need some medical assistance. I'm stopped up.
Right.
I'm coughing. I want some medicine. Well, when the doctor did come in, it wasn't even a doctor. It was a medical
nurse practitioner.
Nurse practitioner. She came in, but she was like 6 feet away, almost. She's standing at the door. I'm on the table, talking, and these are your signs. You know, tell me your symptoms, and I was telling them to her. And to me, it was pretty much routine. Just like a mechanic say, maybe you need to get new battery ends or something like that. Only thing she said, well, I'm gonna look. Do you have any soreness in your throat? She looked down my throat for a second, took them gloves off. Okay, we're gonna give you 2 shots, and she was gone. You know, it's like that's it. I'm not getting too much close to you. I don't need to check you too much. You know, it's like routine.
But probably trying to do is whatever she thought that needed to be done, because like a lot of healthcare workers don't know what people are taking precautions and what people aren't.
Right.
You know, they don't know how people think about it.
I didn't have a problem.
I'll be honest with you. The last time I went to my primary care doctor, well, I go often, but I had to go to my primary care doctor, and they asked me, "Oh, Mr. Wilson, have you gotten your COVID shot?" I said, "Yes, ma'am," and I showed them my vaccination card. They took a picture of it and put it in my file. And from that point on, everybody wanted to touch me. You know what I'm saying? You had the nurse came in, she got me, took my vitals and everything, and the nurse practitioner came in. Of course, they was wearing gloves and a mask and everything, but it was a full exam after that. I think if I had not taken my vaccination, it probably would have been more like what you had going on, Daryl.
Well,
I think too, if you have certain pre-existing conditions, most people have taken it with pre-existing conditions and they've been fine, even to people with transplants. But if there's a particular condition that you have and the doctor says no, then that's a different story. And even then, get another opinion, maybe get two. Because at that point, if you only get one, you got one doctor saying one thing and another doctor maybe saying another. But if a doctor tells you no, and this pandemic is going the way that it's doing, prayerfully it stops, it slows down. But sometimes maybe there may be a reason that as relates to you. Like with that young lady was saying that the doctor said his family. Well, he's more concerned about his family, of course. So ask another doctor. And maybe even another one. Because it may be a reason that or at least ask him the reason, medical reason. Ask him the medical reason that he's telling you not to.
Muslims can't take it, right? If he's Muslim, then they probably can't take that.
Well, there's, I guess you could say, religion's exclusions or excuses.
Yeah.
But I'm pretty sure. I noticed that they was talking about the Afghanistan refugees that were coming here to America. That's a whole nother story. I know if y'all keep up with that kind of stuff. But, I was watching them on news and they were wearing their mask. I mean, but they finna get set up. It's like we're welcoming them to the United States. We finna get the kids in school. We finna get them jobs. It's organizations already working to make sure that the Afghanistan refugees are welcome here in the United States. So that's something we got to be prepared for, and I'm pretty sure it's going to be throughout the whole country. That these 21,000 people that they're bringing in. I want to say. But
yes.
One thing.
See, to me, that's really that's concerning. With what we got going on, and like I said, the war was gonna have to end at some point. Obama wanted to end it. He said that, and they was all no, and then as soon as he left them over there, you said you were bringing our boys home. So Biden just took the grunt of it. Trump started the initiation of it, so it was going to end at some point. But that's the only reason I feel like maybe this wasn't the right time to do that. If we have to accept all these new people in from a different country, they're not climbing the fence getting over, they're actually coming here.
Oh, they're flying them in, yeah, from Afghanistan.
Yeah, they're coming here.
I think they say a plane full a day.
And I'm like, have y'all tested them? Have y'all vaccinated them? No, because you're saying you have to wait 2 weeks to even feel after the second vaccination. So this just started, and they're just coming. They don't know what's going on.
But is y'all seen that? Is it a movie called The Purge or something like that?
Yes.
Can you kind of see? Now, I'm not talking about for all the crazy stuff that went on in the movie, but I can relate to some of the crazy stuff that's going on in the movie. It's like, and those of you don't know, The Purge is like where I think the whole city was on shutdown and stuff like that, and
the whole country.
The whole country. And people went out.
All crime was illegal for 24 hours.
Yeah, crime happening and stuff like that. Well, I think we almost under some kind of mandate, y'all. I think several months ago I said, are we at the point to martial law? Well, they never did get to the point of martial law. But we at some point now we in a new generational society. I guess you can say something of that nature. And something's gonna have to be rewritten to make common sense for everybody. Laws gonna have to be rewritten. Doctor visits gonna have to be reinvented or redone. This virtual education thing, I just see a whole different world, y'all. And don't get me wrong.
We already got that in the doctor's visit too, Daryl, because we got telemed on so much stuff now. They'll call you up and FaceTime with you.
Right. So I'm just watching some of the comments that Stavata is talking, and I understand some of the stuff that she's saying. I do believe the government is paying the hospital to have so many people vaccinated. I do agree. I do agree that uh, I do know there's farmers that were paid, and this is in the past and probably now, to have their crops destroyed. You know what I'm saying? So we don't know what's behind everything. Is it one time I think I read something saying it's a way of downsizing the population of the world. So what we had, 600 and some thousand people that died from COVID just in the United States. Have we hit 700,000 yet? I don't know.
No, we're pretty close to it though.
So it could be a conspiracy theory of a thing, and people think like, I'm not taking this shot, or yep, I'm gonna wait and see what happened to you all. These are all normal. This is kind of normal for people thinking, but also
I get that part, Daryl, but now like we were talking about the pandemic that happened in 1918, you know. So when they came out with vaccines for that, do you think that those people were as hesitant to take it?
I don't think they had. I didn't think they had the technology or the mindset that we have now. We have too many freedoms right now. We have too many freedoms. And they can't make me take it. Oh man, they ain't gonna give me. If you don't give me my food stamp, I'm gonna just go down there and act a fool.
They don't care about going to jail.
Look, you
but
can't.
down,
You can't make me wear no mask.
even throughout those points that you have, when it says to take the vaccine or not, what would you choose?
I took the mask.
You know that you chose, but what would you choose to do it if you say offer to do it again?
I'm gonna take the vaccination.
Okay, in spite of all those theories, because like we can watch movies, and movies do have valid points a lot of times. But if they put it out in the movie, y'all, come on. Somebody should have picked up on this. A lot of smart people in the United States.
Look, I keep telling y'all, this movie, Enemy of the State, years back, about tracking folks with these cell phones. Will Smith.
Gene Hackman.
And Gene Hackman. We had no idea. Well, they thought it was just a movie. But after I found out what I know now, them cell phones, they know where you at, buddy. They know we talking right now.
I watch ATL Homicide every Monday night. And that's how they catch most of their people.
Yes.
By going on that cell phone.
Yes.
Right.
Yes. That phone line is your worst enemy. And when Gene Hackman...
So when people say that, oh, they're going to track you with the vaccine, they tracking you now.
Yes,
I haven't said that. That makes me want people to understand that technology ain't got so small for them to be able to inject it into your body yet. And them have a robot just going around in your body telling everybody where you live. And then what you doing, and what you thinking, and what you eating. I mean, we don't have, the technology ain't that small yet. Who making it? That's all I want to know.
Well, listen.
That have to be something microscopic to be inside of a syringe that they can inject in your body.
Mike.
And all those people who feel like that's the reason why I don't want to take the vaccine because they got nanochips in there. I watch Marvel just like the next person. But Iron Man ain't real. Spider-Man ain't neither.
But I'm gonna just tell you, they watching you. They know where you at.
But for anybody who think that taking the vaccine will save them from whatever they think the government's going to do, come on now, it's the government. Do you think not taking the vaccine is going to save you any more than the person that took it? Right. If it's about them doing what they want to do anyway, right? Then why would they leave you to be in charge? Right. Why would they allow you to be in charge? Because you didn't take the vaccine.
Veronica 2012, the movie 2012, where they have only a certain amount of people they're going to put on these ships and restart the world over, right? Is that movie, I think? So, are you one of those people they gonna use to restart the world back, or you gonna be one they just say pull off and leave leave you to whatever happened? Think about it.
It's like you really want to ask a lot of these people. If you feel like those theories that you subscribe to, and we all subscribe to theories, don't get me wrong, but I'm just saying, if you feel like you see whether it's man-made or not, whether it happened, whether it came from animal, whatever, if it's all government plan, what makes you feel that not taking the vaccine will make you a part of the elite for whatever the ultimate plan is? You ain't got Bill Gates money, you ain't got presidential money, you ain't got power. What makes the fact that you didn't take it makes you a part of the elite?
And some are saying if they stop letting them, if they start making them have to use their sick time when they're off from work and they have been vaccinated, then they'll go and take the vaccine. So they're straddling the fence.
Yep.
You're straddling the fence.
Yep. Yep. I mean, nobody want, and y'all, to be honest, nobody want to take medicine, period. So that's never really been the issue. No, I don't think anybody who's taking that vaccine was happy about it, wanted to do it, or was glad to do it. But we saw what was going on with the virus, whether it was man-made, animal-made, natural, whatever. We saw what was going on. So you can only work with what you got. You can't work with what so-and-so and so-and-so and so-and-so and so-and-so said was going to do this, and the other, when those people, most of the times, aren't reputable sources. What made them privy to these sources? They need to be working for the government.
Veronica, is it still private? Well, I know it's private, don't get me wrong. But, earlier last year when someone died from COVID, it's like, shh, don't want nobody to know. It's whispering. But now it's like, hey, man, they died from COVID, It's like, it's normal now. It's like any ordinary person that got killed or whatever. It's like, it's acceptable that COVID-19 was the cause of the death.
Yep.
Compared to last
year. My thing about that is, because it's been here, not long, but going on 2 years. That some people thought that they may have experienced it during late 2019. I think anything that gives choice, but to say here it is, it becomes more open to talk about it. You see what I'm saying? Like anything that becomes more, the more it's here, the more people will talk about it. You see, the more it's here, people still not wearing masks. It's almost like they're feeling that, well, it's been here, it's going to be here. So it's like it's easier to talk about it. For some people, I guess for them, it's easier to joke about it. And that's sad.
Yeah. I'm just trying to think of a new mask that everybody would be more acceptable to. Is it? I see some people came out with a clear style mask that kind of just forms over your face a little bit. Do you think something that would not cover your face?
Oh, you mean that won't hide your face?
Yeah. I mean,
they had the issue with like you can't even see your children smile. You can't, like a lot of parents that are against the vaccine, like they're tired of their children wearing masks. They don't want their children to grow up in that type of world. I don't know, because a lot of times, like people right now will say, the old blue mask don't help, the old blue mask don't work. Well, we know it's been maybe the blue mask. Yeah, we needed the N95s for the medical, facilities and stuff like that. But it don't hurt to put 2 or 3 of them on. You got 3. When you put 2 of them, you got 6 layers. Well, I see. A lot of people they don't want to put the mask on because it hides their face. They're tired of their faces being hot, hidden. I understand that, but I don't know if they come up with something. If they come up with something stronger, I don't know how available it'll be, how soon it will be available to the community. Because if they come up with something stronger, it's probably most, medical professionals are going to take precedence.
Well, I was just thinking, like if you use plastic, of course, and put it over your nose, eventually you're going to suffocate yourself. But
at one time everybody was trying to use them shields at one time.
Yeah,
and they find out the shield is not as effective as the mask.
Right. So I'm thinking now if they're going to try to come up with something that's stretchable, similar to what they got, but it just forms. It's clear, but it forms to your faith in some kind of way. I guess it gives you maybe some micro holes over the nose area where you can breathe in, or fiber or something.
Like the effect of a filter, where
Yeah,
where it won't, what's out won't come in, but you can breathe out.
Right.
Yeah.
You know, I'm just thinking, is it people just tired of seeing the blue, the black, or whatever cloth all over your face, and then you can't see one another? Is that scary to people, or is it just?
I think a lot of people are tired of not being able to see, see each other. Like it's like some people have to get used to the fist bumps, and then they said don't be doing that. You got the elbow touch, so it just gets. And then and like Shonda was saying earlier, people feel a certain type of way. But who doesn't know why we doing this in this day and time? If you get offended because somebody won't come to your event, or if you get offended because somebody won't, elbow you, and they won't hug you, then where you been? I'm really wondering where you been. And I do think the bigger issue though is the facial thing. Like a lot of people are just tired. Like I saw Busta Rhymes talking about his civil liberties and his this. I ain't never heard him talk about civil liberties. But he was up on stage at his age, talking about he ain't wearing no mask. And I want to give y'all a concert, and I want y'all to see this. No, all this kind of stuff. That's because that's not what he believed. Well, that's another person who Busta Rhymes was 50-some years old. Think about all the people that grew up into him. And I'm just saying, like, people are old enough now to decide on their own. It's not like these younger people like Nas may be influencing these younger people. But he's an older man, and he's up there saying that kind of stuff. That man still has potential to influence some of these older people. Hopefully not on the level where it would be a young person, but he's up there on stage talking about his civil liberties and his this, that, and the other. And what we're basically just talking about is health and safety. Right. We're talking about health and safety. Right. And they're talking about their civil liberties. Like, has he ever advocated for any civil liberties before this?
No, it's about the check, about the back.
Exactly. All of them can't pack up in them stadiums and watch him perform. Mm-hmm. That's what that's about.
Living in them mansions and them mortgage payment got to be made, and ain't that coming in. Yes, sir. Yep. Got to get out
here.
And
what LSU saying, I think LSU, you're gonna have to go up next stadium. You're gonna have to show proof. I think all football stadiums should.
I really think that Alabama should do that same thing.
Right.
But of course, here in the state of Alabama, you don't have to show proof. But I think that they should make that mandatory if you want to go. I mean, they're giving out a whole lot of incentive, free tickets to games. They think it's 6 pairs of tickets to everybody who get their vaccination.
Here, this is what it is. It says proof of vaccination or negative test. So I don't know if they're making them take those on the spot tests, or because over half of them gonna come up in there because they catching that wave is in Louisiana again. So
it's bad.
Yeah, and so they're saying negative test or proof of vaccination for fans 12 years and older. Because at this point with this Delta variant, it's really trying to protect kids. Mm-hmm. And some people are like fighting it harder, and it's mostly they're saying now it's affecting kids so bad. Like, y'all don't want to protect the kids?
Lakeisha,
like they're fighting it even harder, and they're saying that it's affecting a lot of kids.
Lakeisha Davis said, "How does it help by showing proof?" Join the conversation. 310-6067, please. 310-6067. And I'm not. I guess it's because of the game. I guess I'm not sure. But yeah, call in. Don't be afraid to call in. You can call in. We don't have all the answers. I can tell you that now.
Right. We don't have all the answers. But I know a lot of people getting caught with those fake. They getting caught some kind of way. Somebody realizing that they're fake.
But when
they're getting sold on Amazon and other sites, but they're being caught that they're fake vaccination cards.
But think about it, Veronica. When they first came out with them, it's really just a post. I mean, not a postcard. The size
of a postcard.
Yeah. So I mean, it's not like a driver's license type thing where oh, we can verify you've been COVID tested and it's showing on your license. You know what I'm saying? That you're over 21 or
Right.
whatever. So when it
And you
came
know
out
what,
with
Darryl, you know, you were talking about that. That's something that might,
gonna have to
you know,
be.
you were saying earlier, that's something that might, just like now, you have to get the STAR license if you want to even catch a domestic flight.
Yes.
That's going to go into effect in 2023. They extended it.
So now
So if you want to catch a flight, so it may be something like that.
We back at another level of forms of proof. And so, I mean, when they were giving it out, I was like, this card, do you really, what you, they don't want you to laminate it or anything, but it's like a vaccination record, I guess, just like anything else. But I think it should be, this is a little bit more important compared to just a vaccination record where you can just go up to the school and show, hey, my child been vaccinated or this student been vaccinated. I think it's something else needed.
I think they want you to treat it like a social security card. Like you don't necessarily got to carry it with you everywhere, but
if you know you're going somewhere that requires it, yeah.
Yeah.
Oh, okay. The number is 310-6067. Please call that number. 205-310-6067. Lakeisha, that'll get you in contact with us here on the program.
We got a new caller on the line right now, Darryl.
Okay, go ahead.
This is Lakeisha. I was joining in the conversation.
Thank you.
Oh, thank you very much for calling.
I was just wondering and curious how does it help by showing proof that you've been vaccinated? I don't understand the purpose of it. When people that, still being vaccinated still ending up with COVID-19.
Good question. Great question. And
I think because people can still get it with the vaccination, I think that showing the proof of vaccination, it's just like with anything else. You can't eliminate risk, but decreases risk. And sometimes if you get this thing where, okay, say for instance, the numbers are down, or if we hadn't been able to keep them down, if we had kept them down, and maybe say instead of just everybody kind of forget about it, they say, well, you have to show proof of vaccination to get into these home games. Then you get an area like with LSU, they're going to require it. God forbid the numbers start to go up exponentially, like just like wildfire. Then at least they'll have somewhere to pinpoint to say to help the research either way. Well, all these people were vaccinated or were supposed to have been vaccinated. To the best of our ability, they weren't fake cards, but the numbers still shot up. Or all these people were vaccinated. We had these events, and they weren't considered spreader events because the numbers continue to go down. So it seems like that may be working.
Right. And it's all part of research.
So basically, you're saying it helps for the research purposes, but not necessarily help for the spread or decreasing the spread of COVID-19.
But it still helps in general with the spread, because if you started that work there, then you're not going to do that. You're not going to continue to do that. So it should help with them being able to determine what we should and shouldn't do. It'll help with them figuring out what needs to be added or not in what part, because right now we're taking whatever they first came up with. And this booster, I don't know if they're going to add something. They were talking about that with something added to it to maybe help with the Delta variant. So if we're looking at time, that's why they always have these lot numbers and things like that. Well, by this point in time, these lot numbers were dated here. This particular vaccine the numbers still shot up. Well, maybe when they come up with another vaccine, which they're constantly, continuously always working on those, maybe we'll know, okay, it's just all you can do is track. It's like a tracker system to me to see what works and see what helps. And eventually it'll automatically help with trying to get the numbers down, because when you see that something didn't work, then you're gonna redo what you're doing. If you see that it did work, then you know you're somewhat on the right path. And like it's so new, you can't just say it's gonna help this way or it's not gonna help that way right now.
If you look at the numbers going right now, then you can see once again that majority of the people, by a large margin, that are in the hospitals right now, they are unvaccinated people. Yes, you have a few people who are vaccinated that are in the hospital, but it's like drastically large.
Right, that's what those numbers are helping to do now. Because before now they weren't telling us how many in D-Safe were vaccinated, how many were partially vaccinated or not fully vaccinated. So with those numbers, what they're doing now is helping them to decide, and hopefully the researchers and scientists to come up with something else that may be done to make the vaccine better. But it should be giving those in authority enough knowledge to figure out how to do things, because it's happening over a few months. Like I said, just a few months ago it was 5 or less.
Listen, this is my point about that. I get everything both of you all just said. Here's the problem started with our leadership anyway in this country.
Exactly.
Because if you had a virus that started in China, that's contained in China now, and it's outraged in the United States, and you issued out economic assistance, whether it was stimulus and food stamps, why not completely shut the country down, the USA down, for the 2 to 3 weeks you gave out the assistance anyway, and shut it all the way down? It to me is a money game, because our healthcare system now already is about money. It's about money and power, because at the end of the day, we never shut down for real.
And you know what that goes to? We're not a communist country. But remember, y'all, we was talking about China was over there scooping them up in nets. And my thing is, I don't want to be a communist country either. But if it's something this bad, a pandemic that hadn't been this bad in 100 years, sometimes you have to do what you have to do. It's not desperate times calls for desperate measures.
Right.
We did, and like you said, it was the leadership. And now we got that same leadership just spun his butt through Alabama to not get vaccinated. And everybody out there in the audience that supports him is against vaccination, against mask wearing, against social distancing.
And I'm gonna be real honest with you all. Like a couple of weeks ago, I can say this because it's myself. I got sick and I took 2 COVID. First of all, I went to my primary doctor and took a COVID test, because I honestly, nobody could convince me that I did not have it as sick as I was. I stayed off work for a week and a half. I took 2 COVID tests. Both of them came back negative. I just don't believe I did not have it. Now, I was supposed to go today, but I could not go. But tomorrow I'm going to LabCorp to test for the COVID antibodies. And somebody told me they charge $10 for it, so I'm gonna go test for it to see, because I really don't think the testing that we are receiving are getting in properly and being properly tested. Because at my primary doctor, honest to God, she barely put the thing in my nasal.
I agree. I agree with
you. I was so sick, and she told me it was a 24-hour turnaround. When I got to the doctor, it was at 1 o'clock. She said it'll probably be this time tomorrow before your testing come back. I called at 3 to get them time to get all the results in. She said that they still wasn't back. I called back at 5, right a few minutes before they closed. She said it still wasn't back. I called the next day. She said the lady that get the testing result is not in right now. She had an emergency. I said, ma'am, anybody can read me the testing result. I don't care who it is. I think I need to know. She said, well, the lady's not here. We'll call you back. And so from there, I called back that afternoon. Still no test result. This is 3 or 4 weeks ago. You think they called me that as a gift? I still heard from me. Now, mind you, I changed my primary doctor from that point. And I went to Taylorville Medical. Now, this lady, when she tested me, I thought she put it in my eyeball. Right. That's what I thought. That's my doctor. Okay. And so, I think a lot of the people are not. I honestly think I had COVID, but if the testing showed that I did not, and if you have a different strand of COVID, or your test results won't actually come out positive if it's a different strand from COVID-19. So,
see, that's the thing too.
I went to yesterday. Yeah, it was yesterday. I went to Crimson Care, and I went for I'm going by me problem, but it was literally the way they had a system. They have you come in if you're trying to get tested for COVID. You come in and get the application form. You take about back out to your car, fill it out, and bring it back in, and then you get in line in your car. Literally, it was about 50 to 60 people in line outside waiting. They lobby was full, like people was coming in getting flustered and irritated. I honestly don't see how in the world that they kept up with those COVID vaccines, the way those people were in the office. It just, I just don't believe that they gonna get the results, the true results, because the way they work, I could see them losing people testing, because people coming in. They had been there for hours. I ended up leaving. I had been there for almost 3 hours and never made it to the bed.
Oh, well, see, when you went to Taylor, but when you went to that doctor, that's you made that your primary care doctor. Did you, when you went there, what made you decide to also go to Crimson Care? I mean, I know you said you went for another issue, but you were getting a second test. Were you getting?
No, I went to Crimson Care for my knee.
But you were just noticing.
Yes, I was just noticing, paying attention, because there was so many people that was there, and I was like, oh my God. I mean, it looked like a grocery store. It was just that many people there in line to get the vaccine. And I was telling someone else about it. It's like, well, it probably was a bunch of college students. I said, no, it was actually a mixture of college students, old people, and young kids.
Yeah. I think it was probably so many because a lot of people trust him. Because like you say, like the other ladies, they kind of see how they were kind of doing you. You know, and some of these people are overwhelmed, but some of them, you know, even before pre-COVID, you have sometimes you be like, okay, I ain't going here no more. You know, you still got some of that going on too. So some people only trust certain facilities, and that's why they're packed.
I trust Dr. Permaset.
Yeah, so he's going to be packed because some people only trust him, just like some people only trust Dr. Bobo. Some people only trust certain places, so they're going to be packed. But it's still, like you said, though, how do they keep up when it's so many?
How do they keep up? And if you're not properly swabbing the person, and then you telling them they test negative, and then they truly have COVID, if you're not properly testing them, because I know ain't no way in the world that woman would have got, even if I had COVID, she wouldn't have got a proper reading based on what she did by swab that compared to the lady at Taylorville Primary. At Taylorville Medical.
Yeah. I agree with you on that now, on that swab and on the nose. I mean, she kind of like just barely stuck it up my nose. I was like, okay, but I was looking forward to go up a little bit further than that, at least kind of.
It's like you don't want it to, but you prepared yourself to because what you hear.
Yeah. It just felt like it was all up in my brain.
What?
That what scared people when everybody would say, man, they stick that thing up in your face, all up there towards your eyeball. You know, that scares you right there. Then they break out this long ass needle. Excuse my language. Look, they bring out these long needles. I'm like, shoot, ain't nobody want to deal. Us definitely don't want to deal with that right there. So you know, hey. But Keisha, you bring out some interesting points. You're right. You probably and you felt like me. I kind of thought I had it too, because it instantly hit me. It was like out of nowhere. And I said,
right.
"Oh man!"
That's how I was.
And I was like, I was weak.
I was negative.
I was weak for a long time. I had to kind of make myself get up and go to the doctor. You know, like go see what's going on. You know, and I'm like, I don't even feel like moving. But I said, damn, I contacted this disease. And then, right. You know, stuff going through your mind. I'm like, oh no,
exactly.
I can't
so,
see.
I never lost any taste or smell, but everything I eat, even up to today, still tastes nasty. As if I have you know how you have that taste when you sick with a stomach virus, and if the food tastes nasty to you, it's like that for me for the last 4 weeks.
Ooh. You might have had it. I don't think I had it that bad.
Yeah, I mean the food just tastes disgusting to me. It's like it has a taste to it, but it just don't taste good. Like nothing tastes like it normally tastes.
Even still now.
And it's been like 3-4 weeks.
But you know, no one never ever said there's a level 1, level 2, level 3, or level 4 COVID-19 that I know of. And I'm just using that for an example. mild case or moderate case or what heavy case, of COVID. Of course, heavy or critical would be the ones that got to be on ventilators and BiPAPs and stuff like that, compared to a person that, okay, you can breathe on your own, you not have shortness of breath, you hadn't lost your taste, but you have other symptoms. And I think that's something too, Veronica, that no one never really said level one, level two, level three, or level four. Like
Well, it's
now,
just mostly, since it's per person, I think it's more so mild. They may consider some people's case mild, some moderate, some severe.
okay.
And so, you kind of can tell if the person stay home quarantine and they were mild. Well, I guess to them it may not be mild, of course, because anytime a person is sick, it's not mild.
Mm-hmm.
But if they, out of that 2 week quarantine time, they kind of came up out of it and was kind of coming back to themselves, maybe that's considered mild. And then maybe the moderate person may have been admitted but didn't go to ICU, didn't get put on a BiPAP or a vent, but they got medicated in the hospital. Maybe that's moderate. It's just kind of, I guess, an individual thing. And like these vaccines, like I was saying, that there's 4 different variants now. They're using the Greek system. So, and this isn't the Delta isn't the first one. So there was 3 or 4 before that. So hopefully that their thing is that the vaccine, I guess, that's what they've been questioning, how well will it work with Delta? And as we can see, there is some breakthrough. But as they also learned that one is stronger, through with studying it and everything, is more contagious. So it being more contagious to me means stronger. Because if it's more contagious, that means maybe if you are 6 feet away, you need to be 10 feet away. Like I don't do the 6 feet anyway. I always try to stay farther than that. But they say if you're not around someone for 15 minutes, who knows? Maybe this one they saying 10 minutes max. You don't need to be around somebody 10 minutes. So anytime something is more easily spread, to me, I consider that is more contagious. It's a bit stronger. It may not even be stronger, but it's a bit, it's a difference to it. So how will the vaccine work regarding that? And so far, I guess, they had, like I said, 3 already that they had isolated and considered 3 different strands. And it seemed like it worked well against those. Then Delta, and it was going through India, and then it hit United States, and you got breakthrough cases. So that's why I was saying, hopefully, we come up with some type of system, because they got to do something. You just can't just not do anything. So you got to do something, and maybe the cards is just a start. We're trying to figure out, okay, what events were supposedly people were vaccinated or not vaccinated, and it's going to always be some that slip through. You're going to probably find 1 or 2 people, a few people amongst hundreds of thousands that's going to get by with that fake card.
Yeah. But
if you're gonna go through that, why not just go and get the vaccination? Since you want to go ahead on and just try to it ain't like you can't get the vaccination.
But some people don't.
That's why people get fake IDs and stuff.
But some people don't believe in vaccination. I heard people saying that they have never had the flu vaccine and took the COVID vaccine. And the flu killed just as many people, maybe not as rapidly as COVID did, but it killed just any number-wise. But I guess people just afraid of the vaccine. And then it's like, for me, how you came up with a vaccine in 9 months? that was my whole thing. Like, where it takes you 10 to 15 years to come up with vaccine, you came up with one in 9 months.
But that's something why I look at it as they've been studying that type of vaccine as relates to cancer, as relates to immunodeficiency diseases. They've been studying that type of vaccine. The history of them studying it for those things, and so a lot of times people think cancer may be related to viruses. So whatever research they have already, something new comes up, they're going to try to work with what they got already. But mRNA vaccines have been being studied. People just don't know that because people aren't medically inclined, or they're not medically up to date on stuff until something happens. Not all people, but people in general. With this being a pandemic, a lot of people had never heard of an mRNA vaccine, period, until COVID.
Keisha, big question. Vaccinated or unvaccinated?
For me,
Yes.
oh, I'm unvaccinated. I
Oh,
just, me personally, and I wear my mask and I don't be all in people's face. But as of right now, I'm still praying on it. For me personally, I just don't see how they came up with it so quickly. And then I'm gonna be honest with you, what really just deterred me from the vaccine and scared the life out of me when Bill Gates and his wife came up and said they coming up with a cure and they was leading. Look, you build computers and you stole that idea. So they
well,
started talking about microchip and all this other stuff. It was them for me. Like, and then his wife made a statement saying that they was gonna allow the black people to take the get it first, so because it was killing more of us. But then at first it wasn't killing us. Then all of a sudden it started killing us as in black people.
hmm
But then now you talk about you're gonna allow the African Americans to take the vaccine first. It's just I don't. I mean, for me, that's just I'm not flabbergasted. I ain't even gonna lie.
have you lost
Bill
it?
Gates messed it up for Bill Gates messed it up. Bill Gates the reason a lot of people won't take it.
Huh?
If he had said we're gonna let white people take it first, you would have took it.
No. It was the fact that he was talking about. They were talking about the microchip and controlling people and putting it through this vaccine. It was just too much. I don't have nothing
You
against
think that they can put a you think that they can microchip that small?
Do I think that?
Yeah.
Do you think that we would have ever in the history of America walked around with masks on? Anything is possible.
Yeah, I think they can put anything in the vaccine. I do think
Yeah,
that.
anything.
But you know, because you have to be a research. I mean, it doesn't. You don't have to be a research person to know that that's the purpose of vaccines. That's why they put it. The vaccine is made up of whatever they tell you it's made up with. So that's why I always say I wasn't no big fan of no vaccine. I've never been, but I've always with me, even when it was before a pandemic. My thing is okay. If like I always say with the chicken pox, well, if my child get it, hopefully since she's had the vaccine, it won't be so bad. But as far as vaccines, knowing how research is, medicine is, technology, I think they could put anything in a droplet of water.
Think about this.
They don't have to. The chip itself doesn't have to be in the vaccine. The chip is what they will put in you, and that will react to the vaccine. That has reactors from it. So the vaccine is a microchip actually in there? No. The nanoparticles, that's just a measurement of particles. That's a measurement of everything that's in there. But do I think it could be something in there and that they could track people, follow people? Yeah, I think if they get something, it'll make it easier. Even if it doesn't allow them, I think it makes it easier, just like you can track your pets. I think there may be something in there, and then if they finally put something in your phone, whatever they had in there, yeah, I do think. But what I've seen in medicine, even from the 70s and 80s, and this is 2021, I think they could put anything in a vaccine.
And then, Veronica, I don't really know you, but you seem very medically inclined. I don't know what you do. But think about this with us as a people, okay, from years ago, the original years ago, like my grandmother then was getting vaccine, it was only 6 medications in there. Then when we started taking it, it became 30. So it's 30 different things. I don't even know how many it is in there now, but when I was a little girl, it was 30 different vaccines supposed to be collaborated in these vaccines. So now look at our children and look at our men. Now I say this because all of our little kids, that's what they have, bellies, like they pregnant. All these men walking around, they be talking about us women as fat, but all them carrying babies.
And it's the thing that they put, it's the things that they put in the meats, the steroids, the other things besides steroids, the GMOs. So yes, as far as what you can put into something, they injecting those things with medicines. We get injected with medicine. So yeah, I do. I advocate the vaccine because I really do want to be everybody to be healthy. I want as sure as people possible on the ventilators and ICU or whatever. But when you ask me, like I said, I was reluctant because of the thoughts that I have. Now, were those thoughts proven? Yes, I do know that anything can go in a zero. If they could put enough insulin in a 0.1 to 0 or whole 0.1 to 1 point thing to bring your blood sugar from 3 something down to 70. And that leads me to think they can do anything. But as far as medicine and research, they can put whatever they want in there. Now, as far as the chip itself, some people are getting it misconstrued with the nanoparticles and stuff. That will be in there to carry the medicine to the protein. But when you get the chip, then it will say, okay, we see it, we're tracking it. It's just like go back to Steve Austin, the Bionic Man or something. It doesn't have to be that the chip is inside the vaccine. A lot of people are afraid that the vaccine is there, and just like they did say this on the news last week, maybe they may come to a point where they can tell what type of viruses you have, period. And the more they study COVID, guess what? They're studying ways to do other things as well.
Right. So let me ask you.
Also, Darryl, let me say this right quick.
Mm-hmm.
Because I heard on CNN, which I don't watch there a lot of news anyway, because you don't hear nothing but bad stuff. But I heard that on one of the news channels, it was saying that if you got the vaccine and you did not take the booster, the vaccine wasn't going to do you any good. So that could be the starting point of something, a controlling mechanism, and then you got to take the boosters to actually connect the components of all that what Mr. Ronald was talking about.
So look, and if she hadn't took the vaccine and just out here to my ain't gonna take the vaccine, you've been thinking and you've been asking questions that you ain't scared to put the questions out there. What I don't like is when people come up with all these different theories. They straight believe it, and ain't nobody finna tell them nothing, because I'm like, that's just be like me telling you need to take the vaccine and you can't tell me that you don't need to take it.
Mm-hmm.
I still say it's a personal choice, but I do feel like they're working. But like you said, some people thinking, okay, you taking the vaccine now, it's like a mind game, because now they're like, dang, I gotta get the booster. Well, some are gonna say, forget this, I took them first two, I ain't taking no more. But some are gonna be like, oh, I got to get the booster. And they're going to be waiting, okay, is it going to be another booster?
Right.
So some are going to be, because they don't want to, it's kind of like, I understand they don't want to risk getting and being real sick, but some are going to be waiting and waiting. It's just kind of like when some people start fiending for stuff.
Mm-hmm.
So,
and like I think what you mean is, are they going to get people to the point where they want another one, they want another one, they want another one?
So I guess my question now, Keisha, is two questions. Have you lost one to COVID-19? And if you did, have you lost anyone that took the vaccine to COVID-19?
Okay, so the first part is, yes, one of my cousins passed from COVID-19. He was older than I am. I think he was like in his 60s, and he did have underlying health conditions. So, and one of the cheer coaches that was a good friend of mine that didn't have underlying conditions, in good shape at Meridian High School, just passed 2 weeks ago, and she had taken the vaccine.
Okay. So 1 and 1.
So, yeah, it's like, I feel like this is a case study. Like, they know about COVID-19, but they don't know about COVID-19. And so in my mind, it's like a cell phone when it first come out. Everybody go out and buy it, but it got all the glitches in it. I always wait until they buy the first round, and then when they get all the glitches out, I go buy the next round. I mean, I'm being honest.
That's what a lot of people say.
But some people are saying that. People are saying that, but at least you're not like, I don't know if you feel like you'll never take it, but you're not just spreading stuff to try to keep other people from taking it. That's what I don't like.
Yes.
They be like, don't try to force the vaccine on me. Most people who are talking like in a positive way about the vaccine, they're not trying to force it on people. They're just telling you what's being seen. And then the first thing they'll say is, well, I know so-and-so who work in the hospital, or I work in the hospital. Have you worked on ICU unit? Have you treated or taken care of a person with it? Not even in an ICU unit, but just in any medical facility. Just not get to asking those kind of questions, because they're quick to say we're trying to force them or get them to take it because we took it. I could care less what another person does. I care about everybody's well-being, but I'm not going to just as like you can't make me buy Pepsi and I won't Coke.
Right.
You know what I'm saying? So it's like, but you just want them to see like this is something new to everybody, and even they may get something wrong about it. But what did we have? All we had was COVID is here. We finally got the vaccine. And like you said, it was quick. To some people, it was quick, but those vaccines have been being studied for years. But it was quick because it was a pandemic.
Right.
And
I know they can push things through. But you know what? I honestly did not get sick until I stopped. I ran out of elderberry and vinegar that I take every day, and I hadn't had it for like 2 weeks. I just ran now. I didn't go get no more. For one, Walmart stay out of everything right now. But as soon as I got off of that, then I got sick. So I feel like maybe I may have had it, but because my body had some stuff in there to help fight it off, it wasn't as severe as some of the other people that did.
And a lot of people taking those vitamins. So a lot of people they got a regimen. They do the lemon, lime, vinegar, cinnamon is the tea, hot tea. You know, they do that, and they add other things to it too. And then they take the elderberry, the vitamin C, the vitamin D, and the zinc.
Yeah.
Yeah, those are things that are.
Yeah, black people anyway have a lot of people don't even realize this because we don't be in the sun a lot. Most black people have a
vitamin D deficiency. Yep.
I didn't know that.
Oh yeah.
Yep. And so for them, just to take it, as long as you don't like overdose, because like a lot of times they don't even check you for vitamin D. Unless I guess maybe you had tell them certain things may be going on or something. But a lot of times, that's why a lot of times we don't know because they might check for calcium, this, that, and other. But if you look at your thing, you don't see nothing about vitamin D or vitamin C. You see iron, you see your potassium, your sodium, your chloride. But over the past few years, they've seen that a lot of African Americans are low in vitamin D.
Kyle Porter say, man, the grocery got that elderberry if you need some.
Yeah, I need to go get me some because I honestly feel like like I said, I rarely get a cold. Like I probably can count the colds I've had my whole entire life. And then when I got off of the elderberry, which my system still had it in it because I had been taking it every day, but I had been off of it for about 2 weeks, and then I ended up getting sick. But like I said, my COVID test came back negative, but I mean, honestly, if you ask me, I really I'll argue you down. I feel like I did have it, even though it said I didn't have it. But like I said, I'm gonna find out tomorrow because the lady told me, she said, if you got the antibodies in your body, you have.
Because you won't have antibodies for something you didn't have.
And so, Veronica, let me ask you this, because I wanted to know if, just say a person had COVID-19, what was the purpose of them taking the vaccine if they already have the antibodies?
Well, see, you're not. If a person has had COVID-19, they haven't changed yet, to my knowledge. But the standard time is to wait 90 days because there's so many people that have gotten it twice. Some people have said they feel like they may have had it a third time.
So I'm saying, what would be the difference of getting the vaccine when all they're doing is injecting the antibodies in your body, and if you already have the antibodies from having COVID-19?
Well, see, certain things your body will always have antibodies to, but as time wanes, just like with the virus, that's why they were talking about a booster. Well, as time wanes, those antibodies will decrease. And so if you see it again, it may not be enough to fight it off. Your next time you get it, it may not be as severe. And then again, it may be severe. It just depends on what variant is out there at that time. So for people that have had it, they wait 90 days because they don't want to shock their body and give them something. They're getting over it, and their antibodies are most likely so high that they don't need the vaccine. That's why most physicians and healthcare people say wait 90 days and then take the vaccine.
Daryl, you got some questions from our original page. Do you think there will come a time when they try to force it on everyone?
I do. I really do. In a shape, form, and fashion, they're doing it now. But it's getting to the point where it's gonna get to the point where it's gonna start affecting your livelihood. In other words, if you're not vaccinated, then you can't work here. Or if you get sick related to COVID-19, you're not going to be paid for it, stuff like that. So eventually it's going to change the mindset of people that, man, I got to go on down here and get vaccinated. They ain't going to even pay me if I get sick this week or next month or whatever. And it's going to be a transition of of benefits. This whole new COVID-19 going to change a whole lot of things the way we know it for our jobs. Even is it going to affect your family leave act? You know,
You think they gonna do that when people can't find nobody to work now? So
yeah,
they I don't know about that. If they do that, the United States really gonna suffer because like jobs are so you can get a job in anything you want to do right now.
I think it's going to be if they do that, it's going to be awful because people will take what they need, but at the same time, some of these people who won't be able to work aren't that type. They aren't the type of people that say if you got like 10 medical professionals, 10 mine workers, probably two of them going to go out and try to steal it from somebody else. They're just not that type of people until they get to the point where they're so desperate. Then maybe all 20 of them will go out and do that. I don't think it's going to turn everybody into criminals. Most people that go out and take from you is they say they don't take because they try to do this and that anyway. They were going to do it anyway. Now some people do turn to crime when they can't. Like that, we were talking about the conversation with the lady last week. They do turn to crime when they become desperate. But I think so many people are so accustomed to making the money that they make that some of them will, once they start saying that or your job, they're going to go ahead and take it.
I'm saying,
or they're going to take the test.
No, I'm saying right now, every job it is, including the t-shirt bar, constantly hiring because they can't keep no workers. I don't think companies can afford to say, "Hey, you get vaccinated, or don't come to work." When they begging people to come to work.
Oh, they're saying it now. That just right now in New York, the jobs have said today that if the healthcare professionals that are not willing to take the vaccine, they are willing to let them go, even though they're short. Because why? Because they feel like keeping them there, because some healthcare workers are catching it. And they're like, they're still coming to work and they're not willing to take the vaccine. That's putting even more of a strain because somebody's going to have to take care of them. So they're kind of like, lady in Florida said the same thing. They are taxed. Now, their governor in Florida probably is not going to mandate it because he's taking it all the way to court. And they back and forth in the courts. They saying they told him that he couldn't do one thing. Then they told the schools they couldn't do one thing. So it's kind of back and forth. So a lot of this is going to be tied up in the court systems. It's going to get to that point. But in the meantime, people still need to work, and ain't no more stimulus checks coming. It's going to have to be really, really something for some more stimulus checks to come. And some people are not, like I said earlier, you make $40 an hour, and they tell you got to take a vaccine. You got 2 mouths to feed, even if you're a 2-parent home. You missing that $40 an hour bi-weekly check. You're going to reconsider probably taking the vaccine.
Especially when the pressure start coming with the mortgages,
right?
The interest rate going back up and insurance.
Or you're going to look for you to find something to work from home, and they already snatched those up real quick. Few people can find some things right now to work from home, but you're going to have to look at. I understand what you're saying, Keisha. It's like they can't find anybody now, but guess what? They haven't been able to find anybody to work for a while. And some of these places are saying, okay, we're paying 10 to 15 now. Now, some of them, when you get there, they're saying, oh, it's based on your experience, this and this and that. It's almost like fine print in a contract. But there are some places that are paying 10 to 15 and they can't get anybody. So imagine somebody that's been working. They've been a RN for 5 years. They've been a medical tech for 5 years. They've been a lab worker for 5 years. They get $20 an hour. They get $40 an hour. They get $45 an hour. And then you tell them that your whole city or state is mandated if you work this place or that place. You work at the VA. They're not going to lose those benefits. Some will. Now, there's always going to be an exception to the rule. But you think everybody's going to just say, well, okay, I lose my benefits and I lose my bi-weekly check.
I'm sorry.
No, I hope everybody would say that. And you may have some people in the in the medical field that won't say that. But I do believe this is a different type of people, the kids now, and I say kids in reference to the 20 and 19 to
younger
30-year-old. They don't care about money. Money do not thrive them.
Well, they never cared either way pre-COVID, so it's kind of like it won't even be. They won't factor in it anyway.
Exactly. But they do factor in. So my nephew.
How do they factor in? Because a lot of them don't want to work anyway.
I know that is why so many companies are struggling right now. So you take, for example, my nephew asked me yesterday. No, actually this morning. He said, Man, I remember when, now he's 19 years old. He said, I remember when Walmart used to stay on 24 hours. I said, you know why Walmart did not go back to 24 hours? It had nothing to do with the COVID vaccine. Because if you can catch COVID, I mean, COVID, if you can catch COVID at from 6 in the morning to 11 at night, you can catch it 24 hours. But they didn't go back simply because Walmart realized they were making the same amount of money with leaving it closed at 11 o'clock, cutting out all those payroll hours from 11 p.m. to 6 a.m. They saved money, which is why a lot of companies have not even allowed people back into the office, and they were still getting the same amount of work out of them and having to pay less bills. You go down on your insurance because you open less time. So for the company that was able to survive, they learned that hey, I can do the same amount of volume in less time and cut out payroll.
Yeah.
Well, you know, Walmart realized that when they got self checkout way before COVID. They took, you know how many jobs they took away from people with self checkout? Yeah, they were open 24 hours, but when you go in there in Walmart at like 2 in the morning, how many people in there?
It's a lot of
and they have self checkout closed even at that point. You know,
I'm saying a lot of people in Walmart at night, you just don't see them. Those are your unloaders, but they don't even do that anymore. Is what I'm saying. Simply because they can still get the same amount of done in less time. Because what you're gonna do, you're gonna do, and then they cut out. I guarantee Walmart saved millions of dollars just by shutting down from 11 p.m. to 6 a.m. Their insurance went down, their payroll went down, their bills went down. They saved a lot of money by doing it and not going back, which is the same thing what Target did too, because Target went up to what? Target paid $15 an hour. But what they also did was gave you more money per hour, but they gave you less hours.
But what a lot of people don't realize is that Target was a much better payer than Walmart to begin with. For a person going in with no experience out the gate, Target paid much better. And Target still had, and Sam's as well. Sam's used to have overnight people. I don't know if they still do or not, but Target would have overnight people. And when a lot of us would go out there and stand in line to get their lights off, those people had been there for hours. So some of them still went in like 4 in the morning. At Dollar General, they would tell us, well, I get here at 4 o'clock. Meet me at the door and get whatever. So some of them are still going there. They probably didn't need them, like you said, from 11 to about 4. But a lot of these places were still opening about 4. So they were still dropping hours. But when I think about people's livelihoods, I don't think about the Walmart jobs, the Target jobs, the fast food restaurant jobs. A lot of those people be like, I'm going to sit at home anyway. And that was pre-COVID. I think about people, the job, United Airlines. You must be vaccinated as of today, or you will lose your job. They may take a religious thing into account or a religious reason, but United Airlines, I'm talking about people that are having to pay for homes. Like Darryl said, you got to pay for your mortgage. You know, a lot of these younger people still at home, or the young men are living with young ladies, or they kind of rooming together, they're shacking together, and they kind of get some government assistance somewhere here or there, or they're making it do what it do anyway, or they get fast money. So we're talking about average working class people, the people that this country's back is being carried on. The middle class is gone. Like Darryl said, it's the upper poor class, and then it's the wealthy, the rich, and then it's the wealthy. So a lot of those people, those type of jobs have been put in jeopardy because they're saying that they must be mandated.
Because I look at the people like Walmart and fast food restaurants are the everyday jobs. Because when you compare Walmart to the airlines don't have as many employees as Walmart does. So you got very limited. You're talking about maybe.
Can you really truly say that? And even if you look at a scale and Walmart outweighed those people, look at the type of job there. If you don't go fly that plane, you're gonna be well missed, especially certain times of the year, than several people that don't go to work. So it's like, I see what you're saying, but these are big name corporations. That's why they're the ones making the news. Like Walmart has always had that up and down fluctuation, and it may get worse. And I don't see Walmart closing. So, you know, I see people still getting their hours. A lot of people, like I said, sometimes the stimulus checks kept people home.
Taking a big hit. You know why? Because Amazon is taking over.
Walmart. Yeah. So it's other things that's giving them hits anyway. That's what I was saying. It's like, that's why they got the self-checkout. They don't care because they know as long as they get the bottom line that they want to get, they're willing to let some of those people go and not take them back. Because that's one reason I have an aunt right now. She does not do self-checkout. because she said that cost people their job. And she's like, that happened way before COVID. And she's like I say, a lot of these younger people, they'll just go to Burger King, work for 2 weeks. They need a little money. They'll go to the next fast food restaurant and work for 3 weeks. Because these restaurants are staying open, and some of them are paying well, but like you said, they're hiring a lot of people and they're only giving them a few hours. Well, some people work like that anyway. Most times when you go to a fast food restaurant, they only gonna have the supervisor, maybe the crew leaders getting them full 40 hours because they only want to pay so much insurance.
Hey y'all.
So it's been like that anyway.
Listen, we're gonna talk about the effects of COVID-19 for his work and other things on Thursday. We've been at it 2 hours and 45 minutes and 39 seconds. Great conversation though. Great conversation. Keisha, please call back in because hey, you know how it affects the small business as well as the large business. And Veronica, of course, from the medical standpoint, let's finish it up part 2 on Thursday. And Mike, anything else before we go?
I have nothing.
Okay. Hey, we'll talk to y'all on Thursday. Till our producer probably fell asleep. He got to go to school in the morning.
So y'all done worked some past school hours.
Yeah, we worked some past school hours on this.
No, he's on that.
So they got him up. He passed school out.
I think he's saying, I don't know about So listen, hey, I appreciate it, y'all. We'll talk on Thursday more and more how society is going to change, even the church. We're going to go into how church and faith is going to change in relation to COVID-19. I know we went back, but are things still the same? Let's talk about that on Thursday, y'all. We'll see y'all. Appreciate y'all calling in, everyone, all the comments, and we'll talk on Thursday.
Okay, good night, y'all.
All right, y'all. Have a great night.